कोई इको तो नहीं आ रहा?
अभी कोई को नहीं आ रहा है.
ओके ओके फाइन, सो विल फ्रीज दिस सेटिंग. हाँ ओके, थैंक यू.
ओके.
So, when the minister says adopted, got it. Thank you.
हुई हुई ले हुई हुई ले हुई ले हुई हुई ले हुई हुई ले हुई हुई ले हुई
A very warm welcome to Your Excellencies, Director General, distinguished participants.
Good morning to all. I hope everybody could hear me. Good morning, Dr. Poonam.
Yes, Excellency, we can all hear you.
Okay, so let's get started. Excellencies, honorable ministers, WHO Director General, Dr. Tedros, Madam Regional Director, Dr. Poonam, distinguished representatives, ladies and gentlemen. Good morning from Bangkok. I wish everybody is well today. Firstly, I would like to thank His Excellency Mr. Banu Bhakta Dakal, the Honorable Minister of Health and Population of Nepal, for conducting the session yesterday on my behalf. Secondly, I heard that many of you enjoyed the virtual physical activity session earlier this morning. I would like to thank India, Myanmar, Timor-Leste, and my country, Thailand, as well as the Secretariat for their contributions on the video for the exercise this morning. Now I'm pleased to welcome you to the Ministerial Roundtable session on COVID-19. In the last Regional Committee session in 2019, the topic of Ministerial Roundtable focused on emergency preparedness in the region, and the Delhi Declaration on Emergency Preparedness in the Southeast Asia regions was adopted. Emergencies preparedness specifically has a very strong linkages with UHC and health-related SDGs. Currently, the whole world is hit by an unprecedented COVID pandemic. It is essential for all member states to adopt strict public health and social measures. We are now also planning a transition to a new way of living. Excellencies and delegates, the agenda item 6, which is Ministerial Roundtable, has two sub-agendas. Agenda 6.1, country experiences and lessons learned with future transition to the new normal. And Agenda 6.2, maintaining essential health services and public health program in the context of COVID-19. We aim to utilize your esteemed presence today to share our experiences and to agree on actions on enhancing commitment and investment in building robust and resilient health system. I would now like to invite Dr. Roderico Offrin, the WHO representative to India and acting regional emergency director for the WHO Southeast Asia region, to moderate this session. Please, Doctor.
Thank you, Chair, and good morning. Your Excellencies, today we discuss a topic that is current and dynamic to all of us: the ongoing response to the COVID-19 pandemic and management of all health services and programs in this context. As mentioned by the Chair, I would like to draw your attention to two papers that will inform the discussions of this Ministerial Roundtable. the country experiences and lessons learned with future transition to the new normal, and maintaining essential health services and public health programs in the context of COVID-19. To begin, may I now invite Dr. Poonam Ketrapal Singh, Regional Director, to introduce the topic and set the scene for the ministerial roundtable discussions. Dr. Poonam Ketrapal Singh, over to you, RD.
Thank you, Dr. Offren, and a very warm welcome to Your Excellencies, Director General, distinguished participants. Maintaining essential health services throughout the COVID-19 response is a core pillar of WHO's strategic preparedness and response plan and has been central to the region's efforts so far. People's ordinary health needs do not disappear due to extraordinary events. Health security is not only about building capacity to prevent, prepare for, and respond to acute events. It must also be about building capacities to maintain essential health services for the duration of a response and into recovery. In the coming session, we will speak to this need as together we continue to respond to the COVID-19 pandemic by aggressively applying basic public health measures that we know work. Your efforts today will reinforce the region's all-hazard approach to emergency risk management, as well as its quest to achieve universal health coverage. Both flagship priority programs are essential to achieving health for all, which is the goal to which all others lead. The Delhi Declaration on Emergency Preparedness, the Sendai Framework for Disaster Risk Reduction, the Pandemic Influenza Preparedness, the targets identified in WHO's General Program of Work, and the Sustainable Development Goals must continue to guide efforts to build a resilient health system region-wide. Solidarity and cooperation must define the region's onward mission, as they have done from the very beginning of the response and for so many years, as evidenced in the region's flagship priorities, the Southeast Asia region's Health Emergency Fund and the Southeast Asia Regulatory Network, among other innovative mechanisms. Excellencies, last month we came together at the CR Health Ministers meeting to review the results of a WHO survey aimed at better understanding the extent to which essential health services which were disrupted due to COVID-19. Between March and June 2020, the survey showed that many countries in the region experienced disruption in services for communicable diseases, NCDs, mental health, reproductive, maternal, newborn, child and adolescent health, and nutrition. In several cases, the data show that disruptions have the potential to reverse progress in each of these 8 flagship priority areas. We look forward to your reflections and to your continued commitment to the region's sustain, accelerate, innovate vision. We have seen how Bangladesh has expanded the health workforce and developed implementation guidelines to maintain routine immunization. Bhutan developed microplans to ensure health facilities could provide vital services should physical distancing measures be applied, which they were for the first time in August. DPR Korea has made special efforts to maintain immunization coverage with a focus on preventing vaccine stockouts and also reinforcing the health workforce. India has implemented a national 24/7 psychosocial support helpline and continue to strengthen health workforce capacity to screen, refer, or treat mental health issues. Indonesia has been developing a risk mitigation plan with a specific focus on maintaining access to essential health medicines and other health supplies. Maldives has expanded the provision of telemedicine services, achieving significant penetration. Myanmar has allocated additional funds to the health sector, some of which have been invested in strengthening the primary health services on which all people of all ages, incomes, ethnicities, and genders rely. In a remarkable show of commitment, Nepal resumed and completed a supplementary immunization activity that covered more than 2.5 million children with measles and rubella containing vaccine amid strict hygiene and physical distancing measures. Sri Lanka has made special efforts to secure people's access to medicines required to manage NCDs, for example, by issuing extended prescriptions and arranging doorstep deliveries. Thailand has implemented strict infection control protocols to enhance the safety of their patients, the professionals, and people at all levels of the health system. Timor-Leste has made concerted efforts to engage communities to ensure they have comfortable access to routine immunization and other key services. Notably, it has also developed a real-time data portal to identify which sub-districts are performing well and where further resources are needed. Excellencies, your efforts are commendable. Your innovative thinking and rapid action have overcome many demand and supply side barriers, helping to quickly revive essential services and prevent a great deal of avoidable mortality and morbidity. In building on your successes, I urge you to contribute to harness the full power of collaborative regional action as you have gathered to discuss today. Today, I want to underscore 3 messages that are essential to achieving our vision and which will facilitate our joint progress throughout the pandemic response and into the recovery and beyond. First, we must continue to learn from each other's experiences and adapt and apply best practices. Telemedicine has shown substantial value in connecting patients to service providers, which is particularly important to protect high-risk groups. Engagement with the private sector and non-health actors has shown great promise in expanding health system capacity. As you have demonstrated, health workforce challenges can be offset through a combination of strategies, including the recruitment and repurposing of staff and the redistribution of roles. Ongoing efforts should be made to keep health workers safe from infection and violence and to provide mental health psychosocial support. Better data at the subnational level is absolutely essential to identifying and filling gaps that can inform rapid action. We must make full use of the region's knowledge on IHR and the knowledge network which has been established, which is specifically designed to facilitate real-time learning among national IHR focal points. Second, we must continue to leverage formal and informal opportunities to pool our collective strengths. The region has in recent years built formidable institutions that provide real advantages in responding to the crisis. The Southeast Asia Regional Health Emergency Fund, for example, has supported the COVID-19 response activities of 3 countries in the region. It must remain fully operational, and special efforts are required to strengthen the CRF's preparedness funding stream. The Southeast Asia Regulatory Network can facilitate the exchange of information on new diagnostics, therapeutics, and vaccines, and the implementation of good manufacturing practices. From very early in the outbreak, you have shared with one another a range of critical resources, from laboratory supplies to personal protective equipment and more. I urge all countries to continue to step up as and where needed, and to model the solidarity that is required to overcome this crisis. Third, together we must continue to make the case for sustained and scaled up investments in health. A massive global economic contraction is occurring. Unemployment, poverty, and inequality are rising. Public revenues, remittances, and household incomes are falling. Countries in the region will be particularly hard hit. The latest projections from the International Monetary Fund and the Asian Development Bank suggest that in 2020, most countries in the region face a decrease in GDP, which could exceed as much as 10%. Higher borrowings may mitigate the immediate impact, but rising debt levels will create fiscal pressures that could be felt for many years. Without proactive reprioritization, public financing for health could stagnate or even decrease, making the reversal of years of progress made towards UHC. We must make a bold, impassioned case for current health spending to not only be sustained but also scaled up. Additionally, our region has some of the highest out-of-pocket spending on health in the world. Even if government expenditures remain constant, declining household incomes will force many people to incur catastrophic costs or to simply go without. That is unacceptable and will have grave implications for all areas of sustainable development. Debt relief measures will be needed in addition to support from global partners, but we must look within and build on the substantial and often innovative efforts we have made in recent years to increase health spending. It is only by doing so that we can achieve a region in which all people can access the health services they need without financial hardship, and in which emergency preparedness is integrated at all health systems levels and across all health systems components. It can be done. The case is ours to make, and the momentum is ours to drive. Excellencies, in focusing on these and other key areas of the response and recovery, you can be certain of WHO's full support. Over the last 8 months, WHO has been relentless in helping you meet this once-in-a-lifetime challenge. Despite a near global shutdown, WHO has procured and delivered more than 1.1 million pieces of personal protective equipment to the region's member states. We have shipped more than 1.7 million diagnostic tests and we have ensured that all countries in the region have the laboratory capacity to carry out RT-PCR testing, the gold standard. As early as February, a region-specific preparedness and response plan was developed in keeping with our focus on driving impact tailored to country needs. I have been in constant correspondence with you excellencies to offer support and to highlight key WHO initiatives and guidance. For many months now, we have carried out virtual and in-person trainings to increase health worker capacity in a range of areas, from clinical case management to contact tracing and risk communication. We will continue to connect member states' needs and partner capacity via innovative mechanisms such as the Central Supply Portal and the Partners Platform, and by convening our Regional Health Partners Forum. Through WHO Solidarity Trials, we are facilitating member states' participation in global research and development efforts aimed at obtaining novel diagnostics, therapeutics, and vaccines. Through access to COVID-19 tools, that is the ACT Accelerator and its COVAX facility, we are working to ensure your success. Success in reaching life-saving goods, which these efforts will produce. Crucially, since March, the regional office has been working with member states to implement key WHO guidance on maintaining essential health services, Pillar 9 of our Strategic Preparedness and Response Plan. Based on an in-depth study, I have now directed the regional office and country offices to strengthen member state capacity in several key areas of Pillar 9, which will also help build more resilient health systems as part of the recovery. For example, WHO will strengthen evidence and build capacities to improve knowledge base on health service disruptions and how they can be overcome. To do this, we will harness the full capacity of WHO collaborating centers, research, and academic institutions with a focus not only on documenting disruptions and also understanding how they impact poor and vulnerable groups. The regional office will continue to provide in-depth epidemiological analysis of the pandemic while helping member states carrying out uncoordinated program-specific surveys. WHO will support member states to build resilient health systems that can function effectively amid the new normal. Country offices will be critical to this process. The regional office stands ready to support member states to carry out supply chain risk assessments to access supply constraints for medicines, disruptions, and medical services. We stand ready to amplify advocacy aimed at attracting investments to strengthen health systems' resilience as a key part of the recovery. Importantly, WHO will articulate the need of vulnerable groups and promote health equity, gender, and human rights within the pandemic response. In doing so, we will work with countries to include health equity as an objective in COVID-19 response plans. We will prioritize dialogue with partners on access to healthcare and social protection for migrants. WHO will continue adapting its work at the regional and the country levels to support the ongoing COVID-19 response. WHO will also enhance strategic partnerships aimed at immediate, near, and long-term collaboration and continue to engage civil society organizations and NGOs to achieve impact where it matters most, that is, at the grassroots. Excellencies, the crisis we face is above all a health crisis, but as long as it continues, it will have far-reaching impact on all areas of social and economic development. The key to navigating our way through it is in the name pandemic itself. Pan meaning all and demos meaning people. All sectors, all countries, and all partners must come together to strengthen the response and build a recovery and future that is more health secure and in which all people's health needs are met as a precondition to achieving the sustainable development to which we are all striving. Thank you, Excellencies, for your attention.
Thank you so much, RD, for providing us the background and context to the discussions of this ministerial roundtable. To proceed is just to remind Your Excellencies that we will have 2 rounds of this roundtable discussions. And in view of the virtual format of the meeting, I would kindly request that we would all be adherent to the time allotted to us. There will be a traffic light system to guide the discussions as per the usual practice of the RC sessions. And for the first round, the statement may be limited to a maximum of 5 to 7 minutes. The green light will turn amber at the end of 5 minutes during round 1 and will turn red at the end of the allotted 7 minutes. In this round, honorable ministers may like to highlight the most important game-changing interventions to manage COVID-19 from any of the following areas of the response: public health interventions, including surveillance, contact tracing, laboratory testing, information management, social measures, clinical services for case management, governance, coordination, risk communication, and community engagement, innovations, good practices, partnerships, among others. And also the new arrangements for health services to maintain the essential non-COVID-19 health programs with a focus on the regional flagships. And with that, I would like to invite our First Minister, Your Excellency, Mr. Zahid Malik, Minister of Health and Family Welfare from Bangladesh. Over to you, sir.
Thank you very much. It is an honor and prestige for me to be able to address this August gathering and session. Honorable Chair, Excellencies, Ministers of Health, Dr. Tedros, WHO Director General, Dr. Poonam Khetrapal Singh, Regional Director, WHO Southeast Asia Region, ladies and gentlemen. The new COVID-19 pandemic was declared by WHO on 11 March 2020. And since then, Bangladesh has been part of global efforts to tackle down COVID-19. To handle the pandemic, Bangladesh is putting efforts in mass mobilization of the healthcare systems, public employees, and the security forces, combined with an energetic and creative public education campaign. Since the disease does not have a specific treatment yet, the peak can be delayed or more precisely be flattened by the following interventions, and that we did. Coordination. Coordination does not happen on its own, but requires management to allow actors to remain plural and different. While it aims to overcome the pandemic and decrease morbidity and mortality of COVID-19, since the beginning of the pandemic, Bangladesh adopted all government approach to ensure interactive process between all ministries and to achieve the best results through openness, sharing information, and cooperation rather than through applying authority and control. strong surveillance and early diagnosis. Initially, there was only one laboratory capable to do the diagnosis of RT-PCR following the WHO standard. Currently, we have 92 laboratories spread out throughout the country that are working hard to meet the needs of testing. The investment increased our resilience and helps to ensure that our testing and contact tracing system are robust enough to deal with the next phase of the pandemic. We are working to increase the laboratory capacity more and more to reach every district so that each citizen gets the opportunity to be tested for COVID-19 if suspected. Isolation of cases and quarantine the contacts. To overcome the challenges due to the high number of cases, the mild and moderate ones observed home isolation with strict follow-up through telecommunication. The home isolation cases were provided the telemedicine services. The severe and critical cases were treated in the hospital under direct supervision of the trained physicians. The contacts of the cases were asked to strictly maintain the home quarantine. Due to the limitation of institutional quarantine facilities, the peoples arriving from abroad were asked to maintain home quarantine for 14 days and use telemedicine services. Likewise, health system in Bangladesh is facing competing demands from rising number of COVID-19 cases, as well as to maintain continuity of essential health services between April to May 2020. The pandemic has disrupted the utilization rates of inpatient, outpatient, emergency health, RMNCH, immunization and nutrition services. However, gradual increase in essential service utilization has been made possible after June 2020 through the following major interventions. Safe essential service delivery restored. With proper guidance in place, government has resumed normal outpatient, inpatient, emergency and essential services. Uninterrupted supply of basic medications is maintained at primary healthcare settings. Innovative approaches like WhatsApp-based apps like mental health and psychosocial support for patients and healthcare providers are available. Integrated TB and COVID-19 testing using GeneXpert machine is promoted. Nutrition services also were improved and delivered, especially promotional activities like IEC, that is Information, Education and Communication, materials on COVID-19 and nutrition. Address human resource gaps. 2,000 medical doctors and 4,000 nurses are posted at the primary healthcare facilities. Online learning platform is restored for health workers. Dedicated 24 hours functional hotline numbers enable continuous access to essential health services. Health workforce are trained on infection prevention and control measures, including setting triage system. Continuity of routine health information system to guide decision making. That is functional DHIS2 system supports constant monitoring of essential health services utilization. Dashboard under development to monitor essential health services delivery and an assessment to plan to identify the supply and demand side factors influencing the disruption of health service. Promoting rational using of drugs. Efforts are made to maintain good pharmacy practice to ensure quality and safe medicine on the market. We thank WHO for continuous support made already and hope to work jointly a broad range of partners to respond to this outbreak to better protect the people in the region. Thank you very much. Thank you, Your Honor. Yeah.
Thank you, Your Excellency, for giving us all the points that are showed us the great work that has been done to cope with this pandemic in Bangladesh. May I now call on Her Excellency Leon Poden Wangmo, Minister of Health from Bhutan. Over to you, Madam.
Thank you. We would like to inform that Her Excellency has not been able to attend due to some urgent meeting. So I will be presenting on behalf of Her Excellency. Honorable Chair, distinguished delegates, ladies and gentlemen, Bhutan would like to acknowledge that the COVID-19 has severely affected the Southeast Asia region by disrupting socio-economic activities. Member states are facing difficulties in sustaining day-to-day affairs during the implementation of strict public health and social measures including lockdowns. Bhutan's response to current global pandemic is led by our visionary leader, His Majesty the King of Bhutan. His Majesty the King continues to guide Bhutan's whole approach in managing the situation in a very compassionate and selfless manner. 10 days after the outbreak in Wuhan, surveillance at the airport and points of interest have been instituted on 15 January 2020. As the chair of the National Disaster Management Authority, the Honorable Prime Minister of Bhutan activated the national response on 29 January and set up the National COVID-19 Response Fund on 9 March 2020. The royal government has put in measures based on scientific evidences and best practices and followed the WHO's technical guidance in preparing our approach to deal with the current pandemic. We have re-strategized our national response plan to efficiently trace, aggressively test, and early treatment. Additional COVID-19 laboratories and COVID-19 ICU facilities have been established in the 4 regions of our country. An elaborate human resource mapping for the COVID-19 response for the whole country has been developed. An acute shortage of the trained health professionals has been addressed through engagement of retired health professionals and those undergoing medical studies. The government mandates all the incoming individuals to undergo mandatory 21 days quarantine in designated facilities. Interim measures have been put in place to ensure that essential health services, particularly those relating to mother and child health, are provided without disruption. Shops have been identified in different zones as collection and distribution point for medicines and medical refills. Elderly populations are provided with nutrition and vitamin supplements. On the command of His Majesty the King, Buddhists who contracted COVID-19 in New York were arranged free quarantine quarters and access to medical treatment. Repatriation flights are arranged for Bhutanese who wishes to return to Bhutan from abroad during the COVID-19. No charges are levied for quarantine, and they are also provided with free meals and access to internet services. An effective social protection mechanism was patronized by His Majesty the King to provide for both social and economic welfare of the people during the pandemic. Free accommodations were made available to more than 1,000 Buddhist families who were residing in the neighboring Indian town but wanted to return to Bhutan. Every individual in Bhutan is ensured that they have access to all basic necessities, including COVID-19 tests free of cost. His Majesty's welfare scheme not only provides monthly stipend to people whose livelihood are affected by the pandemic, but also helps to clear interest on bank borrowings for businesses affected by the pandemic. The unconditional support from the mainstream media social media influencers, and local government administration have played key role in disseminating health advisories and also ensuring and challenging position. Being a landlocked country with small private sector, Bhutan imports all its medical supplies, including PPEs. Bhutan has been severely challenged in our response to the pandemic from the disrupted international supply chain. We invite WHO and the honorable delegates to our continuing discussion on the agenda pertaining to global shortage of and access to medicine and vaccine, and invite member states in the region to provide impetus on the implementation of RC71 Delhi Declaration that we have all agreed. While fully appreciating the strong presence and role of WHO in the fight against this pandemic, we noted certain challenges for the region that needs to be addressed. Bhutan, therefore, would like to recommend for the institution of a regional warehouse to facilitate and stockpile essential medical supplies required for responding to the health emergencies. This will be very appropriate in our endeavor to realize the regional director's 8 flagship priorities, which are aligned to the triple billion goal. Bhutan welcomes the declaration of collective response to the COVID-19 in the Southeast Asia region as a collective motivation to reinforce our existing solidarity and goodwill. The Royal Government of Bhutan continues to reaffirm our commitment and solidarity with the member states in our joint endeavor towards ensuring that each individual attains enjoyment of the highest attainable standard of health. Thank you and Tishdele.
Thank you, Your Excellency from Bhutan. May I now call on the Minister of Health and Family Welfare, His Excellency Dr. Harsh Vardhan of India. Sir, the floor is yours.
Thank you, Dr. Ofen, and thank you, Dr. Pudam Khetpal Singh ji, for your very comprehensive and visionary statement, which will certainly boost the morale of the health ministries in the region. As we have talked about it earlier also, India initiated public health measures to prevent and contain the spread of SARS and CoV-2 since January 2020. In fact, within less than 24 hours of the first information that was received by the whole world from China through WHO, we had called our first meeting of group of experts. And these measures, which have been taken over the last more than 8 months now, have resulted in a case fatality rate of 1.68%, which is amongst the lowest in the world. To summarize, I would say that a number of measures were undertaken, such as issuing relevant travel advisories from time to time, creation of quarantine facilities for quarantining of persons returning from countries with reported cases of COVID-19, guidelines for community level surveillance, scaling up of testing facilities, tracking and tracing and testing of all suspect cases, establishment of COVID care centers, establishment of dedicated COVID health centers, and also dedicated COVID hospitals for the treatment of asymptomatic to mild, moderate, and severe patients of COVID-19, increasing domestic production capacities for PPEs, ventilators, and other medical items required for the treatment of COVID-19 patients. Also developing guidelines for infection prevention and control, testing protocols, clinical management and biomedical waste management, and then also guidelines to be followed by COVID and non-COVID health facilities, developing a web-based portal, S3 portal for states and UTs to report in detail about the testing, hospital admissions, discharges, deaths, and also to provide them future estimate of their requirement of medical items for COVID patients. Then also directive to all the states and UTs to provide non-COVID essential healthcare services. Then I would also like to mention just three important interventions that Ministry of Health and Family Welfare in the Government of India undertook for the management of COVID and also to maintain non-COVID healthcare services. The most important one of them has been the scaling up of testing capacity. Laboratory capacity for testing samples of SARS and CoV-2 using RT-PCR technique was increased from one lab in January 2020 to 1,678 labs now, including those in the government and private sectors, where we use RT-PCR, TrueNAT, and CBNAT technology. In fact, in a vast country like India, today within a traveling time of about 3 hours, we have an ordinary citizen in the country has access to a free testing facility. The network of laboratories has been developed all across the country, and testing laboratories are supported by a network of referral laboratories also, which collect and transport samples to the testing labs. Further, testing kits using rapid antigen assay and rapid antibody assay were also developed within the country and distributed to all states and UTs to enable testing and field level at the field level and also in containment zones so that we could obtain results in a very short time span. Due to this capacity increase, right now, more than 1 million tests per day are being conducted on a regular basis, which has helped direct a significant number of asymptomatic cases and contacts of confirmed cases. In fact, yesterday itself, we tested almost over 1.1 million people. And this has significantly strengthened and helped in strengthening our surveillance and containment measures. Then another issue about which I would like to mention before the Honorable Ministers and the Regional Director is about the effective clinical management. Various measures were undertaken for effective clinical management of those who contracted the infection. Case definition of asymptomatic, mild, moderate, and severe cases was done by eminent experts in line with the internationally accepted definitions. Emphasis was given and is being given to early hospitalization of those who require facility-based care to reduce morbidity and mortality. We are still working hard to bring our mortality rates to less than 1%. Guidelines were issued for home isolation of asymptomatic and mild cases who do not require any medical intervention. A set of guidelines were also issued for admission of moderate cases who will require oxygenation and other therapy, and to dedicated COVID health centers and severe cases for the dedicated COVID hospitals for critical care. They have all been created in a big way all over the country. Clinical management guidelines to provide standardized healthcare to mild, moderate, and severe cases were developed, and these have been shared with the states and UTs, like all other advisories from time to time. The clinical management guidelines were reviewed and updated regularly as per the latest clinical data that was available to us from international sources from time to time. Centers of excellence were also set up in medical colleges and in the medical institutes of every state and UT to update the knowledge of the faculty of the state level colleges and institutes. Online training is also provided to by the experts from apex medical institutions of the country to the faculty and medical practitioners at the state level. Then another issue is about maintaining essential non-COVID health services. The importance of maintaining essential non-COVID health services was recognized during very early phase of the pandemic, as it is equally important to provide life-saving healthcare to patients with chronic ailments, malignancies, blood disorders, to pregnant and elderly, and those with emergent conditions that require urgent attention. And I would reiterate and say that right from the very beginning, we paid adequate attention to this very important aspect, which might have been ignored at many places. The directive was issued to all the states not to convert all their health facilities as dedicated COVID facilities and identify some as non-COVID facilities so that they continue to provide healthcare services to those who require urgent medical care. There is a lot of innovative interventions that have been done over the last 8 months, but the paucity of time and the discipline that we are all supposed to follow doesn't allow me to talk about everything. I have to thank WHO once again for organizing this roundtable discussion, and it will make all of us far more richer in terms of our experience to deal with COVID in the future also. Thank you.
Thank you, Your Excellency, Dr. Harsh Vardhan. And we will also have another round later to add some more points that you may want to continue. Now from Indonesia, may we call on Dr. Oscar Premadi, Secretary General of the Ministry of Health of the Republic of Indonesia, for his intervention. The floor is yours, sir.
Thank you. Mr. Chair, Excellencies, Ministers, Regional Director of WHO, ladies and gentlemen. On behalf of the Minister of Health of the Republic of Indonesia, I would like to thank you for organizing the Ministerial Roundtable of COVID-19 response in this 73rd session of the WHO Southeast Asia Regional Committee meeting. I thank you for head of delegation of CRO member states for the insight. It is indeed enriching our collective learning process in combating this pandemic. Before I start my interventions, allow me to provide a brief update on the current COVID-19 situation in Indonesia. As of the 6th September 2020, there are 194,109 cases in Indonesia, with case fatality rate 4.4%, in which higher than the global rate. Our data showed that the center of pandemic in Indonesia is still dominated by 5 high-density provinces, which are Jakarta, East Java, Central Java, South Sulawesi, and West Java. However, I assure you that the control efforts are still ongoing, improved, and strengthened. Ladies and gentlemen, in August, Indonesia, per the International Health Regulation, has conducted the COVID-19 Intra-Action Review, aimed to assess the national public health system, capacity and emergencies response system, as well as to identify sections that need to be continuously improved and strengthened to control the pandemic. Based on the review, I wish to highlight some of the Indonesia best practices in the COVID-19 response as follows. First, we are of the view that reviewing of the operation plan of COVID-19 response through the multi-sectoral stakeholders intra-action review is one of the best practices. This mechanism has allowed us to collectively identify best practices, gaps, and contributing factors for correction actions in terms of coordination, planning and monitoring, risk communication and community empowerment, surveillances, rapid response team, risk analysis, and epidemiological investigation, operational and logistic support, port of entries response, large-scale social restrictions, laboratory, infection prevention control, case management, and essential health services. Second, the formation and implementation of the multi-sectoral task force of COVID-19 response as an intervention of the whole government and whole society approach. The development of this task force has mirrored with adjustment the pandemic influenza contingency plan that has also been referred to in developing the COVID-19 operational response plan. Third, the utilization of the partners' online platform for COVID-19 that serve as a tool in increasing the effectiveness and mobilizing the resources from national and international development partners. And fourth, innovation, which is since the beginning of the pandemic, we have seen innovations in all scale. Innovation made by home industries that produce personal protective equipment, such as masks and coveralls, has helped fulfill the tremendous demand for good quality and affordable PPEs. Other innovations that have been emerging are the development of locally made ventilators result from the collaboration between universities and industries, in which supporting Indonesian vision toward medical devices independence. Moreover, the development of Indonesia Nusantara Sehat program, a special program of health professional deployment, has helped fulfill the surge of demand for quality human resource for health during the pandemic. Ladies and gentlemen, Indonesia has performed several best practices in maintaining the essential health services in Indonesia during the pandemic situation, such as, first, the utilization of data of the Family Approach Healthy Indonesia program in mapping risk factors for NCDs and NCDs as COVID-19 comorbid. Second, the maximization of telemedicine technology. Third, the continuation of health services with modification, including the drug dispensing mechanism to allow patients, particularly ones with good adherence in medicine consumption, to receive their medicines for the multiple periods. Fourth, temporary redistribution of human resources to support the operation of affected public health centers. And fifth, the civil and military collaboration in delivering essential health services. Chair, ladies and gentlemen, to end my intervention, I'm looking forward to hear experiences and best practices from the rest of head of delegations. I thank you.
Thank you very much, Your Excellency, Dr. Oscar Premadi. Now we move on to Myanmar. His Excellency, Dr. Mintwe, Union Minister of Health and Sports. The floor is yours, sir.
Honorable Chair, Honorable Ministers, Madam Regional Director, and distinguished delegates from all member states, good morning. On behalf of His Excellency Dr. Nguyen Thuy, Union Minister for Health and Sports, I would like to share our country intervention that we apply to manage COVID-19 and maintain essential non-COVID health services. I'm Dr. Tathonjo, Director General for Union Minister Office, Ministry of Health and Sports, Myanmar. Ministry of Health and Sports has started the response since 5th January 2020 after getting information of unknown pneumonia outbreak in Wuhan, China. Ministry of Health and Sports has conducted daily coordination meeting and guided on the policy development and evidence-based decision making. The very first intra-ministerial meeting on the Wuhan outbreak was held on 8th January 2020. After the declaration of the COVID-19 as a pandemic on 11 March, the National Level Central Committee on Prevention, Control, and Treatment of COVID-19 was established on 13 March 2020. The committee is chaired by Her Excellency State Councillor to provide necessary guidance and coordination on policies, strategies, activities, regulations, law enforcement, and direct to the regional governments, ministries, and international organizations. On State Councillor leads social mobilization during pandemic. All her efforts are exemplary for successful leadership and governance, hand-washing demonstration, cloth mark campaign, live stream interviews with stakeholders. Strong leadership and good governance play key roles in implementing the whole of the society and whole of the government approach in pandemic response in Myanmar. During the initial phase, we mainly focus on the strengthening of surveillance at point of entry to prevent and contain the possible importation of COVID-19 cases to Myanmar. One of the successful activities is quarantine measures depending on the evolving epidemiological situation. We practice facility quarantine earlier than the neighboring countries. We executed international travel restriction and put travelers and returnees under facility quarantine since March 15, 2020. We plan to change the strategy to home quarantine of the contacts depending on the intensity of the community transmission. After the restriction of the international travels, relief flights for the returnees citizens have been arranged by inter-ministerial collaboration and the leadership of the local governments. At the same time, quarantine sites were expanded and laboratory capacities were enhanced to support the surveillance. Scaling up the biosafety level 3+ and gene expert platform at the subnational and district level were done to detect the case early and to contain the outbreak. For the laboratory testing, in early days of the pandemic, we have sent suspected nasopharyngeal and oropharyngeal throat swab sample to National Institute of Health Thailand, and then National Health Laboratory can do self-testing by ourselves since 20th February 2020, when positive and negative sample results are 100% concordant with results of the WHO reference laboratory. And then we can expand our laboratory services for testing COVID-19 at Department of Medical Research, Public Health Laboratory Mandalay, Molmiai, and expect to start Public Health Laboratory Taungji in mid-September 2020, so that our country-wide sample taking and testing in respective area for the confirmatory diagnosis of COVID-19 are very guaranteed. Public Health Laboratory Lasio can hopefully participate in COVID-19 testing in late 2020. Gene Expert Machine, which is other platform for COVID-19 testing, are now located in the 27 laboratory. For the risk communication and community engagement, we used advanced GIS technology. COVID-19 surveillance dashboard, maps and data visualization have been developed and incorporated into ministry website page to provide real-time updated information about COVID-19 since February 8, 2020 to the public through national channels, ministry official webpage, and Facebook page minimize the spread of rumors. Health Literacy Promotion Unit, Ministry of Health and Sports has developed several health promotion materials electronically and in paper form to spread health messages to reach all corners of the country. After quick implementation research on these awareness activities, handheld loudspeakers were used to deliver the message to the community. For the preparedness at the hospital, Department of Medical Services enforced all hospitals to prepare screening to outpatient department and emergency department to avoid overcrowding by providing waiting area arrangement of the specialist OPD time. We developed checklists to check readiness of hospitals and monitor the activities. Preparation of isolation ward and quarantine rooms within the capacity. Strengthening of infection prevention and control activities at hospital. For the clinical management committee was formed at the central level, led by our permanent secretary. Professors and the concerning subjects are incorporated since early February 2020. They also develop clinical management guidelines, SOPs, and support clinical decision for all physicians. Plasma convalescent therapy is also used for some COVID-19 patients. A total of 17 patients received plasma convalescent therapy. Psychosocial support for patients is also done by arranging psychiatrists and medical social workers at referral hospital. Human resource mobilization to prioritize hospitals are done by voluntary proposal, including specialists, medical doctors, nurses, as well as technicians. Since the beginning of the outbreak, we try to maintain essential health services at all levels. Immunization activities are suspended in late March and April 2020. It was resumed rapidly in the middle of May, depending on the evolving situation of COVID-19. We also put our effort on maintaining surveillance performance of vaccine preventable diseases to achieve the global and regional goal, especially measles and rubella elimination by 2023. The guidelines and SOP on prevention of COVID-19 delivering health services are developed for specific health services like SOP for the provision of service for immunization, disease control, including TB, HIV, malaria, and NCD. New challenges faced by the healthcare workers in service delivery during new normal are addressed. With the support of the government and development partners, Myanmar is trying to build back better by strengthening the health system in the post-COVID period. Thank you.
Thank you, Dr. Tartun Chaw, for walking us through all the pillars of the response in Myanmar. Now let us move on to Nepal. I give the floor to His Excellency Mr. Banu Bhakta Dakal, Minister of Health and Population for Nepal. Over to you, sir.
Thank you, Roderico, Honorable Chair, Excellencies, distinguished delegates, ladies and gentlemen. I am pleased to share Nepal's experience on health sector response on COVID-19 and also measures adopted to continue essential health service. From the very beginning of the pandemic, Nepal adopted whole of government approach to response to COVID-19, which includes socio-administrative, clinical, and public health intervention. A high-level coordination mechanism was established under the leadership of Honorable Deputy Prime Minister to provide the overall guidance for coordinating various sectors. Similarly, incident command system was activated at the Ministry of Health and Population to coordinate the overall sector response. Similar mechanism established at sub-national level, which are playing vital role in mobilizing different sectors to respond this pandemic. The critically important interventions that help us to respond and suppress this pandemic is mainly due to four major interventions. Firstly, quarantine of the retinue. Second, testing capacity. Third, designated COVID hospital. And four, risk communication. More than 400,000 people who returned from other countries were quarantined for 14 days, mostly in the institutional site managed by local governments. However, recently Nepal adopted a policy to allow home quarantine where RT-PCR results are available within 72 hours of their arrival. Nepal significantly encouraged testing capacity. While the first case was sent to WHO, a collaborative center for testing. At present, testing capacity has been increased to more than 22,000 per day, which is double than the per day needed. The testing priority is given to symptomatic, primary contacts, high risk, and frontline workers. Based on the load, government has allowed private laboratories and hospitals to test. Nepal designated more than 120 COVID hospitals across the country to manage COVID-19 cases, who received budget, logistics, and technical support from the federal ministry. Government has given major emphasis to strengthen oxygen supply system in the COVID designated hospital, which remain central focus, strengthening clinical capacity. Health workers who are engaged in responding COVID-19 are being provided additional benefits, including financial top-offs to their regular salaries. Moreover, the government of Nepal has guaranteed treatment of health workers and also offered a life insurance package from them. Risk communication has been top priority of the government. Various communications platforms like radio, television, newspaper, social media, and dedicated web portal and call centers were utilized significantly. Moreover, daily media briefing also help to aware community and also address myth and rumors. All type of media and mechanism were mobilized to aware community and ensure the right informations reach the different target groups. Moreover, other major proactive policies and institutional agreement that help a lot to respond to COVID-19 are more than 42 guidance documents such as plans, guidelines, protocol, and standard were developed and implemented. Health sector budget has been reprioritized and allocated for COVID-19 response. Logistics and supply system have been strengthened and we are able to maintain community stock at least for 2 months. Sub-satellite hospital network have been activated, emergency medical troops are being mobilized and hospital beds are increased. The government has received significant support, particularly essential logistics for COVID response from health cluster partners, multilateral and bilateral agencies, which was instrumental to increase testing coverage and identify cases earlier. Essential health service and supply continue from the beginning of the pandemic and also during the complete lockdown. All the health facilities remain open to provide public health service and conduct regular priority programs. However, the limited movement might have restricted access to some extent. Data from routine information system and others rapid assessment are being utilized to access the service disruption. It was noticed that during initial phase of the lockdown, utilizations of some key essential services were dropped. However, in the recent days, service utilization has been improved. It was notable that Nepal conducted the nationwide measles and rubella campaign and oral polio vaccination in 90 selected districts during the difficult time of pandemic. We believe this will help us to achieve the measles elimination target by 2023. Nepal is gradually easing lockdown since 12 June 2020 to resume new normal. However, adherence of public health measures and standards remain challenging, which was evident in the recent assessment conducted in the Kathmandu Valley. Thank you.
Thank you very much, Your Excellency, Mr. Banu Dakal. Now we move on to Her Excellency, Ms. Pavitra Waniyarachi, Minister of Health for Sri Lanka. Over to you, Madam.
Your Excellencies, Regional Director Dr. Poonam Singh, distinguished participants. I would like to express my appreciation for having this roundtable to share our experience, giving equal emphasis to the management of COVID and the maintenance of non-COVID essential health services. As the Chief President Gotabaya Rajapaksa and the government of Sri Lanka took an early decision on the restriction of public activities, preventing the spread of COVID-19 and emphasized on expanding hospital care to accommodate a large number of COVID-19 patients. We face the challenge of adequately maintaining essential but non-COVID health services. The COVID response included the initial restriction of public movement, which continued until the situation was manageable without severe restrictions. Aggressive contact tracing, widespread establishment of quarantine centers, frontline health personnel working together with defense personnel, supervised home quarantine system, risk communication to the public, rational PCR testing, expansion of existing government hospital care facilities to cater isolation units and treatment wards, with all confirmed patients managed in government hospitals free of charge. Island-wide free ambulance services to transport any suspect patient from home to the isolation hospitals. Local manufacture of PPE to increase their availability. A hotline established with a caller risk grading system to prevent and manage unnecessary visits to hospital are noteworthy interventions that we implemented directly in the COVID response. The response was also seen from other professionals by a variety of innovations that resulted, ranging from local foot-operated hand wash facilities to robots that could dispense medication. On the other hand, non-COVID essential health services were maintained, in particular for emergency health care. The free ambulance service here too served the purpose. Distribution of essential NCD and other long-term medication that was provided through clinics were distributed in collaboration with the postal service. Emergency obstetric care was emphasized with the conduction of a rapid assessment of maternal death during the early phase. Antenatal care for high-risk mothers were maintained with postpartum visits being carried out using recommended PPE. Child immunization service and distribution of nutrition supplementation was resumed at the earliest possible time. And there was continued access to medication for TB, HIV, leprosy, and filariasis delivered to the doorstep. The availability of PPE was further stepped up to a support performing essential non-COVID health services. Returning Sri Lanka from countries having malaria during this period were also screened in quarantine, and considering that there were positives detected early, we have been able to maintain the country free from malaria. Timely risk communication was used to also curb a dengue outbreak that was predicted during the time. What I have mentioned addressed some of our region's flagship areas too. Although it is difficult to say which was more important, noteworthy is our grassroots public health system, supported together with the defense personnel, which made possible the aggressive contact tracing and quarantine. The predominant government hospital infrastructure that was rapidly modified to accommodate testing and treatment and making it free to all is noteworthy in our response. In summary, these were three important interventions taken by Sri Lanka. Firstly, a regular review committee at the national level under my chairmanship, which provided guidance. Secondly, the taking of prompt action after analyzing the epidemiological situation with a scientific approach. Third, the continued risk communication to the nation. Thank you, Chairperson.
Thank you, Your Excellency, from Sri Lanka. And now we move on to His Excellency, Ambassador to the Democratic Republic Peoples of Korea, to the Republic of India, His Excellency Che Hui Kol.
Regional Director of WHO Regional Office for Southeast Asia. Dear Honorable Ministers and delegation members, first of all, availing myself of this opportunity, I'd like to extend my sincere gratitude to Dr. Pranam Ketrapal Singh, Regional Director of WHO Regional Office for Southeast Asia, and her work team of the Secretariat and Ministry of Public Health of the Kingdom of Thailand, the host country, for their efforts to ensure the successful organization of the regional committee amid the serious situation caused by COVID-19. COVID-19 has affected 213 countries and regions, claiming more than 800,000 people within the last 9 months since its outbreak. However, I can say with great pride that there is not a single case of COVID-19 in the DPRK until now. The precious experiences and lessons gained during the fight against the COVID-19 are: firstly, all countries and governments should have political will and determination to prioritize and thoroughly guarantee the life and safety of their people. At the beginning of outbreak of this pandemic, many countries failed to take resolute and appropriate measures, only considering the economic and diplomatic values before others. Worse still, some countries are gradually lifting anti-epidemic measures for the mere sake of economic interest, as the COVID-19 situation has shown signs of partial improvement, and this in turn is bringing another upsurge in the epidemiological situation. Our governments formally took a resolute measure of totally closing territorial borders, including sea and aerial routes, on January the 8th, 2020, in order to thoroughly check the inroads of the COVID-19. We still keep complementing and maintaining the strong anti-epidemic status even at present. Needless to say, sustaining such anti-epidemic measures is always easier said than done, as it is always topped with confusion and losses in the socio-economic area and the economic and foreign trade activities. It is not an easy decision to make. However, it was stemmed from the responsibility to prioritize the safety of the people and submit everything to it that the government of the DPRK took the great and bold decision in spite of these losses. Secondly, the experience is that good results can be expected only when the fight against the invisible COVID-19 is turned into a self-conscious undertaking of the state and all people as a whole. You cannot expect any success from anti-epidemic activities that are sporadic and coercive. Since the beginning of the outbreak of COVID-19, our government has established the Central Emergency Anti-Epidemic Headquarters, comprising of all administrative institutions, social organizations, and mass media, which takes unified commands of the national anti-epidemic works from the central level down to province, county, and communities. Under the baton of the Central Emergency Anti-Epidemic Headquarters, all state affairs are being subordinated to anti-epidemic works, and the concerted actions of all institutions, organizations, and people ensure unity of actions from the central to the peripheral level to prevent COVID-19. Intensified information, education, and communication activities on the global situation of COVID-19 through the TV, radio, and newspapers and other mass media has made people accept anti-epidemic work as a vital work for their families and country's existence and voluntarily take active part in it. Together with these practical anti-epidemic measures, such as obligatory mask wearing, social distancing, hand hygiene, disinfection of public places, issuing anti-epidemic instruction and guidelines, closing service facilities including resorts, extending school vacation, and inspecting imported goods have been taken and thoroughly implemented. Thirdly, the government should give full support in stabilizing the life of the quarantine and the people in the areas in quarantine while strictly applying the anti-epidemic measures against the COVID-19. Unstable life of the people cannot bear a good result in implementing the anti-epidemic measures taken by the government, but on the contrary, foments social disorder. From the beginning of the pandemic outbreak, the government of the DPRK has been directing its primary concerns on stabilizing the life of the people, especially of those in the areas in quarantine, thus making all people actively participate in the anti-epidemic works as whole, with full belief and confidence in the people-oriented policy of the government. For instance, in July, the country had faced with a critical situation in which the vicious virus could be said to have entered the country, with a runaway who went to the South Korea 3 years ago, who was suspected to have been infected with the vicious virus, returned, illegally crossing the demarcation line. In such unexpected situation, the government closed the Gasan city and a top-class alert was issued throughout the country. And during the quarantine period, the government provided the people with all necessary food and commodities and even allowances to families in isolated areas. Taking a good advantage of these experiences and as the master for the livelihood of the people, the government of DPRK will discharge its full responsibility and mission of protecting the lives of people by maintaining the current high vigilance to prevent the inflow of COVID-19, thus contributing to the international anti-epidemic fight against COVID-19. Finally, we call on all member states to fulfill their national and international obligation for the health of their people with the stand that the achievement of any state in the promotion and protection of health is of value of all as indicated in the WHO Constitution. And we call for the firm unity of the countries of the world in the fight against COVID-19 under the leadership of WHO. Thank you.
Thank you very much, Ambassador. And now we move on to the Maldives. May I give the floor to Ms. Ishat Samia, Permanent Secretary, Ministry of Health of the Maldives. Over to you.
Thank you, Rodrigo. Regional Director, Excellencies, ladies and gentlemen. Of the numerous interventions that were put in place to respond to COVID in Maldives, I would like to highlight the following. Firstly, communication. Effective and timely communication to the public was initiated very early, even before the pandemic was declared. Both risk communication and information about the evolving global situation and the national response was extensively given and is being continued in multiple languages and platforms to cater to the expatriates and different groups. COVID prevention guidelines for different sectors have been provided for implementation to the new normal. So in essence, our response has been an all government and whole of society approach. Secondly, except for the first few samples sent abroad in early February, we have been able to undertake testing in the Maldives by end of February, starting with the tertiary hospital in the capital and have scaled up testing capacity in Maldives in labs across the country and are able to test approximately 1,000 to 1,500 tests per day. Effective and aggressive contact tracing is one of the few tools we have in controlling the epidemic. Maldives have been successfully running a contact tracing system for all positives, with tracing for over 90% of cases completed within 48 hours. The multi-level, multifunctional COVID-19 intervention management database is what I want to highlight next. At the moment, this system can not only take those who need special attention, those in the high-risk category, but facilitate sampling, quarantine, isolation, and also have a function for the clients to provide and receive information. Technology played an important role for maintenance of non-COVID essential functions too. Teleconsultation with mobile medical response during the lockdown situation and online training for healthcare professionals were conducted for this purpose. Finally, special measures to contain the spread of COVID to the capital, including introducing mandatory quarantine for those coming from abroad and going from the capital Male to other islands and testing after quarantine. The travel and quarantine requests are also handled through the same information system in partnership with the local councils who will approve requests and monitor those who go to quarantine. From today onwards, 10th of September 2020, we will also require mandatory pre-arrival PCR test for tourists and those who come for short-term visits to the country. Thank you.
Thank you, Aishat Samia. And now let's move to Timor-Leste. May I introduce Dr. Feliciano Da Pinto, Director General, Quality Control Cabinet, Ministry of Health, Timor-Leste. Dr. Da Pinto. Yes, Dr. Da Pinto. Dr. Da Pinto, the floor is yours.
Thank you very much. Honorable Chair and Vice Chair of the 7th section of WHO Regional Committee for Southeast Asia, Dr. Poonam Singh, Regional Director, WHO's Southeast Asia Region, Excellencies, Delegates, ladies and gentlemen. Timor-Leste wishes to thank the Secretariat for bringing this important discussion into the ministerial roundtable. Like other countries across the globe and in Seattle, Timor-Leste is making concerted effort to respond to this unprecedented crisis. The first case in Timor-Leste was confirmed on 21 of March 2020. Since then, we have had 27 confirmed cases. One case is currently in isolation. All others have made a complete recovery. Between May and July this year, there was a period of 100 days when there were no cases of COVID-19 in Timor-Leste. All cases so far have been linked to imported cases or are within quarantine facilities. Our expanded surveillance and testing strategy does not suggest community transmission at this stage. Compared to other countries, there have been fewer cases in Timor-Leste so far. However, we remain vigilant and alert to the importation of cases from outside the country, especially from across our land border. We continue to prepare for a potential surge in cases in the near future. Factors that have contributed to Timor-Leste's successful response so far include, firstly, our management of all people entering Timor-Leste. Every return traveler undergoes compulsory quarantine in a government identify or government inspected facility for 14 days. This has ensured that all our current cases are restricted to the quarantine facilities and has been crucial in preventing community transmission so far. Secondly, the government has provided support to build the trust of our people so that they find it easier to comply with strict restrictions on their livelihood. This includes a cash transfer to all poor households in the country, supplementary feeding programs, and electricity allowance and income support for employers so that they can continue to pay their employers. This also includes the provision of financial support to our students stranded overseas so that they can sustain themselves outside Timor-Leste. This has reduced the risk of importation of the virus from high incidence countries into Timor-Leste. Thirdly, international solidarity from our partners has been key to responding to this crisis. All three levels of WHO have provided crucial technical and logistical support, and the leadership of Regional Director Dr. Poonam Singh has helped to guide our response. In addition to other UN agencies, multilateral and bilateral partners, including the Government of Australia, USA, EU, China, Republic of Korea, Japan, Portugal, and New Zealand, have provided invaluable support. Finally, we are making concerted effort to maintain our essential health service to ensure that we do not have a second health crisis in addition to the coronavirus pandemic. Our achievement in improving immunization coverage is a good illustration of this. Following our first confirmed case in March, there was a 30% reduction in coverage for childhood immunization in April. But May, an aggressive vaccination drive improved coverage. In fact, coverage for some vaccine-preventable antigen for July 2020 have surpassed uptake for the same month in the previous year, 2019. We hope to translate this success across other programs as well. We continue to strengthen our preparedness and response and look forward to continued leadership and support of WHO in this difficult time. Thank you.
Thank you very much. Thank you very much, Dr. De Pinto. And now we move our last intervention for the first round with His Excellency, Mr. Anutin Charnvirakul, Deputy Prime Minister and Minister of Public Health of Thailand.
Excellencies, Thailand was the first country to detect a COVID-19 case outside China in early January. Until the 4th of February, the number of cases in Thailand ranked the second in the world. But now our rank is at 122nd. By mid-May, we have successfully hammered down and maintained zero local transmission for up to 101 days. I would like to share this with you, the three most important game-changing interventions for our initial success. First, the whole society approach with the top political commitment and actions. In early March, we established the Center of COVID-19 Administration, chaired by the Prime Minister, General Prayut Chan-o-cha. The center actively involves multi-sectoral top-level leaders, public and private sectors. A daily press conference by the center's spokesperson provides essential information to the public and repeatedly motivates healthy behaviors. Never before that we have seen such strong commitment and solidarity among all sectors. Second, the nationwide public cooperation on effective, strong social measures. We implemented very strong social measures, including closure of public areas, no all mass gathering, control of domestic and international travels, and curfew in high-risk areas. Thai people actively follow the public health measures on physical distancing, hand hygiene, and use of face masks. Local government and community also play very active roles nationwide. Third, our universal health coverage and many social innovations. Our USC covers all COVID-19 health services to everyone on the Thai soil, from testing to full treatment and care. With strong public health systems, we can test, trace, and quarantine all suspicious cases. We strongly apply the 3P safety policy for patients, health professionals, and people. We limit to only one entrance into health facilities with temperature screening, hand sanitizer, and mandatory use of face masks. Physical distancing is observed in all public areas. The acute respiratory infection clinics are relocated outside hospitals' main building. We have successfully expanded our testing capacity to more than 200 centers all over our country. For non-COVID-19 patients, we apply various interventions. For example, use of digital platforms. The well-controlled NCD patients are referred to primary healthcare centers in order to reduce overcrowding at hospitals. Refill of essential medicines for some chronic diseases by local pharmacy. Medicines are delivered via post-village health volunteers. Finally, Excellencies, our challenge is to successfully control COVID-19 with minimal negative social and economic impacts. While we are waiting for the vaccines, we must keep our guard high, and at the same time, we need to gradually and carefully reopen our economy. Thank you.
Thank you very much, Your Excellency. I think that ends our first round, and maybe just a quick roundup of what we have learned from all of you. I think all the countries are in different states of the transmission of COVID-19, and all countries have really made valiant efforts in controlling and preventing further spread. We have also seen that you have sustained all our response areas, whether it is to test, trace, and treat. This sustaining vigilance is the only way for us to be able to combat the difficulty in which economies and societies are suffering, and sustain the engagement of communities in compliance for public health and social measures. There is a need to accelerate our collective work because there are many unknowns to this virus and how it will spread. You have shared with us ideas of regional stockpiling, regional warehouses, the importance of internal review to further learn how we will proceed and of course, the continued exchange and discussion. Finally, to innovate, every country has innovated, whether it is simple innovation of local technology or using existing services such as postal services to very high-tech applications for telemedicine and robotics. So I think with that, sets further the scene for the next round. Before we move into that, I would like to hand over to Robert Chelminsky, Acting DAF, for a break. Over to you, Robert.
Thank you, Dr. Ofrin. Excellencies and distinguished delegates, today's health break includes some stretches to address the office syndrome. We are focusing on the neck, shoulders, and our back. The team is fit by the beach, and the video is prepared by Tiny Hearts Maldives. Please ensure that you have around your seat there is a space and to follow the video.
Thank you, Robert. For round two, Your Excellencies, the green light will turn amber at the end of 2 minutes. During round two, it will turn red at the end of the allotted 3 minutes. That's our timing. Honorable ministers may consider highlighting high-level strategies in response to what is next. What are strategies that we may be able to apply to ensure that there is an increased investment in health emergency preparedness and response, as well as IHR core capacities to prevent future pandemics. To begin this round, I would like to call on His Excellency, Mr. Anutin Charnvirakul, Deputy Prime Minister and Minister of Public Health of the Royal Government of Thailand. Over to you, sir.
Model of opportunity favors only the prepared mind. 4 decades ago, our public health investment was mere 4% of the total government budget, or less than 1% of our GDP. Now it moves up to more than 15% of total government budget. As Madam Regional Director mentioned yesterday, that this is higher than the global average at 9.8%. Any social and economic crisis always have opportunities. Thai government provides additional budget to health sector to fight COVID-19, which is not only for short-term health responses, but also for long-term health investment. The investment in vaccine research, development, and production capacities have also been well supported in order to strengthen and ensure our long-term vaccine security. In addition to the government-approved almost 40,000 new official posts for health personnel, for non-health professions, the government approved honorarium compensation for 1 million village health volunteers. This health workforce is part of 1,000 surveillance and rapid response team, which are the core capacity of our IHR system. As I said yesterday, we must learn to look for opportunities in any crisis to move for long-term sustainable health investment. Excellencies, was only the prepared mind.
Okay, thank you very much, Your Excellency. Now we move to Sri Lanka. Her Excellency, Ms. Pavitra Waniyarachi, Minister of Health of Sri Lanka. The floor is yours, Madam.
Thank you, Chairperson. Your Excellencies, Regional Director Dr. Poonam Singh, distinguished participants. Today's discussion on increasing investment in health emergency preparedness and response, and international health regulations core capacities to prevent any future pandemic is very relevant. The government of Sri Lanka is fully committed to preserve health investment. As we recognize the difficulties in doing so, we will take the path of prioritizing health actions. Investment that support expanding coverage for essential health services will be given priority. In Sri Lanka, the long-standing public health architecture played a significant role in the COVID-19 response. Therefore, it is important to further strengthen the existing public health infrastructure and the motivation and momentum of public health staff. We also recognize that many other public health functions need to be supported and given priority to reduce the healthcare access burden. Further, the investment that support towards the above are related to effects and implementation of IHR in the country. Antimicrobial resistance, zoonotic diseases, food safety, biosafety, and biosecurity, whilst sustaining the successful immunization program are key areas of focus. Our national laboratory system will be improved to capture real-time surveillances. The scope of early warning system is to be expanded to cover multiple hazards. The Sri Lankan government will continue to invest in the emergency response operations at national and international level. The ongoing COVID-19 response clearly made us understand the linkages between public health and security authorities that are important to maintain national security. Continued investment needed to deploy health personnel in emergency response is understood, as well as for risk communication in its changing need. We are deeply concerned of investment needed in strengthening points of entry, as it clearly plays a critical role in maintaining the country free from COVID-19 outbreaks, and also of any other pathogens and chemical and radiological hazards. Let me conclude by stating that Sri Lanka has considered investment into health emergency preparedness and response, and strengthening IHR core capacities to prevent future epidemics as a matter of high national priority for preserving health security in the country. The continued support of the WHO and the platform created for regional dialogue is deeply appreciated, as reviving of our economies will depend on collective decisions that we make together. Thank you, Chairperson.
Thank you, Minister. And now we move on to Nepal. His Excellency, Mr. Banu Bhakta Dakal, Minister of Health and Population of Nepal. Over to you, sir.
Thank you, Moderator, Honorable Chair, Excellencies, and distinguished delegates. Nepal has prioritized the budget allocations to support COVID-19's response. The health sector budget has been significantly encouraged in this fiscal year. Government has ensured adequate funding to support COVID-19 response, mainly from the special fund, which is called Coronavirus Infection Prevention, Control and Treatment Fund. Moreover, additional resources are mobilized from regular program, budget or plan and development partners. The plan covers budget for 300-bedded infectious disease hospital at the federal level and similar 50-bedded hospitals in each province. It also includes major institutional reform agenda, including the establishment of CDC, FDA, and accreditation authority. Moreover, biosafety level of laboratories and health desks at the point of entry will be also strengthened further. Our immediate priorities include contact tracing and quarantine of close contact and testing capacity, building of health workers to manage critical cases, production and supply of oxygen, improved community awareness, engagement to improve compliance to public health standard, and continuation of essential health service. We believe these are important areas to focus to move forward new normal. We would like to request WHO and global health partners to establish sound mechanism to ensure equitable and equitable distribution of new vaccine against COVID-19 to the member states. Nepal has been putting its efforts to strengthen the IHR core capacities we look forward to working with WHO and partners to strengthen our international health regulation core capacity, and we will welcome and major intervention and moves in this direction from regional office and headquarters. Thank you, Chair and Moderator.
Thank you very much, Your Excellency. Now we move to India. His Excellency Dr. Harsh Vardhan, Ministry of Health and Family Welfare. Sir, the floor is yours.
Thank you, Dr. Ofren. Thank you, Dr. Poonam Khetapal Singh, and all our dear colleague ministers, excellencies. I'll just make a very brief intervention. In India, a host of strategies are being implemented in the medium to long term to strengthen our core capacities under the international health regulations of WHO in order to augment the health emergency preparedness and response to prevent adverse effects of future pandemics in India. The Prime Minister had recently launched a very ambitious program about Atmanirbhar Bharat. And under the Pradhan Mantri Atmanirbhar Swasth Bharat Yojana, budgetary investments in health sector has already been increased to strengthen healthcare services, health emergency preparedness and response, and thereby strengthen IHR core capacities in a very big way. Expanding public health infrastructure, improving healthcare service delivery and quality. Also strengthening disease surveillance systems and outbreak response. Enhancing biosecurity preparedness and population health research are some of the focus areas under the Yojana launched by our Honorable Prime Minister recently post this COVID outbreak. In order to strengthen the core capacities, the Ministry of Health and Family Welfare, Government of India, will adopt a coordinated approach with the states and UTs to work on a common framework to achieve the stated objectives. Further, we are also taking steps to enhance biomedical research and biosecurity policies, food and drug security and safety, create a coordinated implementation platform responding to multi-sectoral needs, including the engagement of the private sector in a big way. Efforts are also being made to identify with precision the bottlenecks and also to remove them to stimulate indigenous technology development under the Make in India initiative. During the last 8 months, after the COVID outbreak, health has received the much deserved attention in a big way. The Government of India has supported the state governments. Significant amount of money had been specifically allocated for the expenditure on health related issues and more particularly for strengthening all infrastructure facilities all across the country to deal with not only this pandemic, but also to simultaneously make sure that we are better prepared for any such unfortunate pandemic in the future. So I would say that in a way, COVID has taught many lessons to the whole world and for India also, where through our national health policy, which was launched in 2017, there was already a commitment to improve our GDP spending on health significantly by the year 2025. So this whole activity has received quite a big boost. And right now, this is not only the Ministry of Health which is working towards this goal. The Finance Ministry as well as many other ministries. There is a very thorough total government approach. And the way the things have been supported by everyone from all sectors of the government to strengthen the health movement in the country to deal with COVID. I think this is a great reassurance from the government for the people working in the field of health. And I can say with the utmost confidence and certainty that in times to come, as per the international guidelines, advice, and of course the lessons that we have learned for being better prepared to handle these emergencies in the future, India is now much more committed under Prime Minister Narendra Modi to handle issues, and also not to handle only, but also to support them with the backing of finance also. Thank you.
Thank you, Your Excellency. May we now move on to Bangladesh. His Excellency Mr. Zahid Malik, Minister of Health and Family Welfare for Bangladesh. Over to you, sir. Sir, your mic is muted. Would you kindly turn on your mic? We cannot hear you.
Can you hear me?
Yes, now we can.
We can.
The floor is yours, sir.
Sorry for the inconvenience. Honorable Chair, ladies and gentlemen, being a disaster-prone country, Bangladesh is affected by various types of natural calamities such as cyclone, flood, and disease outbreaks. Emergency preparedness is a continuous process in which risk and vulnerability assessments, planning and implementation, funding, partnerships, and political commitment at all levels must be sustained and acted upon. It relates to health system strengthening, disaster risk reduction, and operational readiness to respond to emergencies. Since the International Health Regulation came into force in 2007, Bangladesh has made substantial efforts to strengthen the country's capacity to prevent, detect, and respond to health emergencies. We worked hard to enhancing preparedness through the implementation and regular assessment of international health regulation, national capacities to mitigate the effect of public health emergencies, including the emergencies of a novel pathogen. With WHO assist, we will strengthen our capacity by developing evidence-based preparedness and response plans, preserving emergency medical buffer stock, conducting capacity building activities, strengthening laboratory capacity, and maintaining coordination through cluster and health approach. We will continue to revise and update our national health sector emergency preparedness and response plan. In addition, for capacity building, relevant trainings and simulations will be conducted in disaster-prone districts and division to develop, train, and skilled health professionals that are very much essential for effective, efficient, and coordinated response in health emergencies. We are trying to boost up our economic activities without compromising health requirements in this COVID-19 pandemic under the leadership of our Honorable Prime Minister Sheikh Hasina. This conference would strengthen our health activities, sharing the activities, experiences of member countries. Finally, we will continue to strengthen our National Health Emergency Operation Center for managing information and planning and effective use of resources throughout the country. Thank you.
Thank you, Mr. Minister, Your Excellency. May we now move to Timor-Leste. Dr. Feliciano Da Pinto, Director General, Quality Control Cabinet, Ministry of Health, Timor-Leste.
Thank you, Honorable Chair, Excellency, distinguished delegates. I would like to thank the Secretariat for including this important issue on the agenda. To support the response to this pandemic, the government of Timor-Leste has provided an additional COVID-19 emergency fund. Multilateral and bilateral partners have also contributed with logistical and financial support. However, preparing and responding to this and other future pandemics will require strengthening of core international health regulation and health system capacities to help emergencies. This will need technical assistance, human resource, capacity building, and logistical support. As a signatory to the International Health Regulation, the government of Timor-Leste is committed to strengthening international health regulation capacities for future shock. Since 2018, a joint external evaluation has been conducted to comprehensively assess the international health regulation capacities for all the 19 technical areas, followed by development and launching the National Action Plan for Health Security, which describes a blueprint for strengthening the priority areas of international health regulation capacities over the next 5 years in the country. To support this, the government has increased the general budget allocation for health this year. This extra funding will contribute to strengthening the health system capacity. However, further financial, technical, and logistical support will be needed. With the launching of National Action Plan for Health Security and other health system strengthening initiatives such as Saudina Familia, some partners have shown their interest to support for improving the international health regulation capacities and strengthening the health system in general. We look to collaborate with our bilateral and multilateral partners to identify and generate additional resources so that development assistance for health system strengthening improvement is improved in Timor-Leste. I'm confident of the support of our partners in this journey. Thank you, Excellencies, for your attention.
Thank you very much, Dr. Da Pinto. Now we move to Maldives. Ms. Aishat Samia, Permanent Secretary, Ministry of Health for the Maldives. Over to you.
Thank you, Rodrigo. Regional Director, Excellencies, ladies and gentlemen. This pandemic has highlighted the significance of investment in public health. This includes a special focus on attaining and maintaining the IHR core capacities, as well as continuous improvement of the capacity of health professionals on the ground level to respond to public health threats. We aim to emerge from this pandemic with a plan to better respond to such events in the future. Maldives joined the COVAX facility to ensure access of COVID vaccine once it's available to priority groups at affordable rates. Currently, professional teams are preparing the national plan to roll out COVID-19 vaccination at the population level. With close monitoring of disease progression trends, there is also transitional planning towards institutionalization of COVID-19 response as a national public health program. At a broader national level, there is also a development and implementation of recovery plan focusing on transitioning to normal situation, living with COVID-19, and continue non-COVID services, emphasizing on emergency medical services, reorienting public health program or systems, and develop health system capacity with focus on decentralized care and digitalization. To address the economic challenges, keeping in mind the current circumstances, we intend to bring in a fine balance between health measures with economic and social opportunities. Planning step-by-step approach to open up economy with close monitoring of health indicators and adequate health measures is imperative. Thank you.
Thank you, Maldives. Now we move on to Myanmar. Dr. Tartun Chaw, the floor is yours.
Distinguished Chair, distinguished ministers, head of delegates from the member state, and Madam Regional Director. We are experiencing the biggest pandemic of our lifetime. Most of the current strategies and activities based on our pandemic preparedness plan and SOPs. However, for some other activities, we are learning by doing. We have to build up the capacity in hospital preparedness, infection control, surveillance and laboratory capacity throughout the pandemic and post-COVID period. Member states will need technical assistance from the WHO, and we seek WHO's support to provide both technical and the logistic for adapting new normal, including strengthening of IHR core capacity at national, regional, and global levels. Most importantly, we will try to provide essential health services in innovative and new normal ways in line with the technical guidance from WHO. In a pandemic, once a safe and effective vaccine becomes available, we need to secure the key principle that some people in all countries are vaccinated rather than all people in some countries. Otherwise, we will not be able to end the pandemic. No country is truly safe until everyone is safe. The Southeast Asia region urgently needs safe and efficacious COVID-19 vaccine to protect the most vulnerable, stop transmission, and prevent resurgence of COVID-19. To help secure this key principle, COVAX has been founded. We support the global of the COVAX facility, which is to ensure equitable access to all countries. Countries participating in COVAX will benefit with sufficient vaccine doses to immunize up to 20% of their country population. We, the governments, are willing to join the COVAX facility by sending non-binding expression of interest. As part of the COVAX facility, we would strongly ask the Gavi Advanced Market Committee for commitment for COVID-19 vaccine, secure access to COVID-19 vaccine for 92 low and lower middle income and ID eligible economies at the same time as all other participants. COVAX is believed to make sure that all vaccines in the portfolio meet the safety and efficacy criteria set out in the WHO target product profile. Southeast Asia members are asked to engage with collaboration mechanism to implement the access to COVID-19 tools accelerator, including by participating in coming Gavi briefing in late September and early October, and to prepare the vaccine development plan and readiness plans. Based on our current experience and lesson learned, we have to be prepared. Thank you for your kind attention.
Thank you, Dr. Tartuncho. And now let's move to Indonesia, who will be represented by Dr. Muhammad Subu, Senior Advisor for Health Economy to the Minister of Health. Over to you, sir.
Thank you, Mr. Chair. First, Regional World Health. Ladies and gentlemen, thank you for this and best practice round one ministerial roundtable. Ladies and gentlemen, general perspective, the total health budget years has been stable of the total thing to not now have this way of that it to other relevant agencies. Ladies and gentlemen, 2017 has conducted in evaluation regulation since in 2008 has issued the quarantine as instruction of the national capacity to prevent and to respond outbreak global emergency caused by biological and in 2000 National Action Plan on Health legal among as our undertaking budget plan of regulation related activities. We are linking pandemic existing disaster framework that us to agency funding upon pandemic as disaster central and all government. In addition, global health security inception into 14 in participate permanent steering group sharing the group 16 the zoonotic packets and provide the support. Global health security accept start 2005 by promoting investment in global health national priority, leveraging high-level commitments to global health security. I thank you.
Thank you, Dr. Subu. And now we move to the Ambassador of the Democratic People's Republic of Korea to the Republic of India, His Excellency Mr. Chae Hui Kol.
Pandemic has resulted in loss of over 800,000 lives and huge socio-economic damage on global scale in no more than several months. This grim reality calls on every government of member states to elaborate its strategy to prepare and respond to current COVID-19 as well as the future pandemic threats. To realize this, firstly, WHO and all governments should formulate a principle of treatment in parallel with preventive medicine in public health. Naturally, public health policies, circumstances, and conditions differ from country to country. However, public health policy focusing only on treatment cannot prevent the outbreak of COVID-19 and subsequent numerous infections, victims, and socio-economic losses. Identification of risk factors of any disease outbreaks and timely response to the public health emergency. In other words, preventing people from being contaminated rather than treating them after they get the disease is the way to avoid and minimize infected cases and losses in advance. In the DPRK, preventive medicine is the guiding principle of public health policy. Public health law of the DPRK stipulates that the state shall take advanced measures to prevent the people from getting disease, regarding as an important task in its activity, and exert primary efforts for preventive medicine in public health. In conformity with this, the household doctor system has been established. Screenings and anti-epidemic works and immunizations are performed through this system, and risk factors of disease are constantly monitored and controlled. I believe that governments of all countries would establish prevention-based public health policy, which can identify and mitigate the risk factors of communicable disease outbreaks, thus contributing to welfare and promotion of health of humankind. In this regard, WHO should give a necessary assistance to the member states. Secondly, every government needs to establish an integrated and resilient public health and anti-epidemic system that can respond to public health emergencies and disease outbreaks at all times. Sporadic response to health emergency and disease outbreak is less effective, and only when integrated public health and anti-epidemic system, as well as anti-epidemic institutions which ensure united guidance, monitoring, and coordination are established, we can expect success in the fight against disease. No one can be sure that a dreadful disease like COVID-19 will never happen again in the future, and its consequences will be beyond imagination once we fail to control the outbreak timely. But establishment of well-organized and resilient anti-epidemic system can reduce the national investment in public health and save the lives of people from the threats of eventual pandemics. It is also important to engage all walks of life and organization in anti-epidemic works in order to achieve success in fight against the pandemic. The health institution alone cannot overcome the pandemic. The response should be pan-governmental and pan-social affair to be able to control the pandemic disease at an early stage. In other words, ensuring close link among all stakeholders, including line ministries, civil and society organizations, mass media is of key importance. The DPRK has established a central emergency anti-epidemic headquarters involving all ministries of the government, anti-epidemic institutions at all levels, mass media, and social organizations. In our country, the anti-epidemic works are regarded as crucial issue related to life and death of the nation, while subordinating everything to it. And it has been turned into nationwide campaign combined with high awareness and unified coordination. At present, what's important in the fight against global pandemic is for WHO to play its role to meet the expectations of member states and for governments of member states to unite all the efforts and strength. WHO should make every possible efforts to facilitate research and development for vaccines and therapeutic medicines, which plays a decisive role in eliminating the COVID-19 and ensure equal access to vaccines, treatments, medicines, and diagnostics. The current emergency crisis of COVID-19 is not only a challenge, but also an opportunity for WHO and governments of all countries. The government of DPRK considers that revision and update of the International Health Regulation 2005 are necessary based on lessons learned and experiences gained from the current COVID-19 crisis. The government of DPRK, as the master for the livelihood of the people, will discharge its full responsibilities and make continuous efforts to safeguard the people's lives and happiness of the families by enhancing anti-epidemic status to consolidate current success without any complacency and laxity in the fight against COVID-19, thus contributing to the international anti-epidemic activities. Thank you.
Thank you, Your Excellency. And now, last but not the least, representing the Minister of Health from Bhutan, Dr. Karma. Bhutan, the floor is yours. Yes, Bhutan, Dr. Karma, the floor is yours.
Can you hear us?
Yes.
Now we can hear you. The floor is yours, Dr. Carr.
Thank you, Dr. Rodrigo. Excellencies, distinguished delegates, Madam Regional Director, for Bhutan to ensure the essential and emergency healthcare needs of the population during COVID-19, Bhutan simultaneously developed a plan for provision of essential healthcare and emergency services. The Essential Health Services Package was focused on maintaining the mother and child health services, immunization, services for the vulnerable populations like young infants, elderly people, people with disabilities, treatment of chronic diseases, including mental health, ensuring continuity of critical inpatient therapies, managing emergency health conditions, and common acute presentations that require time-sensitive interventions. Considering that the impact of pandemic would be substantial among vulnerable populations, we have carried out population mapping and line listing of the vulnerable groups. This was to ensure that the vulnerable groups get the priority and to minimize the impacts on their health. At the district levels, we developed microplans separately for essential health services with a focus on repurposing the resources. Separate units have been established for addressing COVID-19 and for delivering essential healthcare services. We have also leveraged on the partnerships and collaborations with other sectors, stakeholders, partners, so as to facilitate provision of healthcare services. Volunteers are oriented on preventive measures, and they form a critical part of the workforce towards communication and campaigns in the communities. Also equally cognizant of the gains realized in the key public health areas, our focus continues to be placed in sustaining these gains. We constantly monitor our key performance indicator through our routine HMIS to take stock of the service utilization trends in this COVID pandemic time. In order to ensure mother and child health services, operational MCH clinical guidelines have been developed. All health workers have been oriented on these new guidelines. Further, line listing of the pregnant women, mothers, and children and vulnerable populations have been carried out by each health facility. Till now, there has been no disruption of any of the essential health services. We have even conducted a routine HPV vaccination of the girls and achieved 95% nationwide coverage of the first dose of HPV vaccination. The health facility-based vaccine delivery strategy was implemented due to closure of the schools as an alternative. Flu clinics set up to reduce the risk of COVID-19 transmission in the hospitals have integrated TB screening. HIV case detection and follow-up have continued as usual. Despite the COVID-19 pandemic situation with lockdown and border seals, we were able to mobilize all the malaria and dengue control tools well in advance. First round IRS continued and completed in time before the lockdowns. LLIN distributions were carried out within April and May to all the risk populations. Malaria and dengue case-based surveillance and interventions around the index case were also carried out without delay. This year, unlike last year, we have no dengue outbreak situation in the country. COVID-19, though devastating to health and socioeconomics of nations, has given us this opportunity to relook at our health systems with focus on primary health care, essential public health functions for universal health coverage, and emergency preparedness for future threats. It's a wake-up call for the world to appreciate and consolidate the ongoing efforts at emergency risk management, increased investment of resources, and skills and innovations in building resilient health systems to ensure continued health services and public health programs in any disaster and health emergency. Most of all, it has given the world yet another opportunity to come together during such a crisis to show our solidarity and support to each other through sharing of experiences and resources. Leaderships at the country levels, region, global levels play important role during such crisis. It has also proved to the world that all of government approach is needed even to tackle infectious diseases. We are confident that post-COVID, under the leadership of WHO, our health systems will be more resilient, sustainable, and well prepared for any emergencies in future. Before I conclude, I would like to invite the honorable delegates and CRO to consider taking forward our continued discussion on pooled procurement of essential health products and diagnostics. Thank you, and Tashidele.
Thank you very much, Dr. Karma. And that ends the round 2 of the ministerial roundtable. Maybe just as a quick recap, indeed, what the chair has said, this crisis is an opportunity. It's an opportunity for us to rethink, relook before we reinvest and rebuild our health systems so that in the future we do have a comprehensive public health system that is resilient to any emergency in the future, and that we can say with full commitment to the next generation that we have done everything so that this never happens again. And with that, I would now like to invite Dr. Tedros Adhanom Ghebreyesus, WHO Director General, for the concluding address on the way ahead. DG, the floor is yours.
It's only 5. Thank you very much. I'm very glad to see our colleagues virtually. Excellencies, dear colleagues and friends, thank you to all of you for the discussion today and to the WHO Regional Committee for Southeast Asia for the opportunity to participate in this discussion. As you know, COVID-19 is an unprecedented health crisis that demands an unprecedented response. I have said repeatedly that the most important ingredients are national unity and regional and global solidarity. It's clear to see that regional solidarity is strong in Southeast Asia region. Although your region has suffered and is still suffering, it's encouraging to see you're coming together to confront the pandemic as one. Globally, more than 27 million cases of COVID-19 have now been reported to WHO and almost 900,000 deaths. In Southeast Asia, today marks a grim milestone with more than 5 million cases reported. And on current trends, the region will pass 100,000 deaths in the next 10 days. The true cost is likely to be significantly higher. The spread of COVID-19 has impacted nearly every community, overwhelmed health systems, and disrupted economies and livelihoods, with effects reaching far beyond the health sector. It has also disproportionately impacted the most vulnerable. WHO recently surveyed countries to understand better the priorities of countries in the Southeast Asia region. At the top of the agenda is maintaining essential health services. Our surveys show that critical services have been suspended, including routine immunization, diagnosis and treatment for non-communicable diseases, family planning, and more. More than half of countries in the region have limited or suspended outpatient, inpatient, and community-based service delivery platforms and mobile clinic services. Many countries also reported disruptions in emergency and critical services. As I have said before, the best defense against any outbreak is a strong health system. WHO is committed to supporting our member states in maintaining and strengthening essential health services in 3 key ways. First, immediate adjustments to ensure continuity of essential services, including working with regional focal points to provide support to countries. Second, building medium-term response across society based on the health-first approach of the socio-economic response plan. And third, implementing a specialized approach to service delivery for fragile, conflict-affected and vulnerable settings under the Global Humanitarian Response Plan. The survey also showed that your second priority is learning from each other, as each country has valuable experiences to share. To meet the need, WHO is developing a web-based health services learning hub that will allow countries to share experiences and learn from each other. Another priority is telemedicine, which is making a resurgence in the region in light of the COVID-19 response. WHO is promoting telemedicine as a means to deliver more essential services during this time. We're helping ministries of health to mainstream telemedicine as it becomes an integral part of the new normal, and supporting our member states to adapt rules and regulations to make effective use of this technology. Another priority is health workforce strengthening. It goes without saying that our health workforce is at the core of everything we do. This is the International Year of the Nurse and Midwife, but we have to honor and support all of our health workers every day of every year. The pandemic has put an enormous strain on health workers all over the world, and many have paid the ultimate sacrifice while serving others. Globally, around 14% of COVID-19 cases reported to WHO are among health workers, and in some countries it can be as much as 35%. Also, data are limited. 1 in 4 frontline health workers worldwide have suffered depression and anxiety, with nurses at especially high risk. It's vital that health workers have a safe and dignified workplace and have the pay, the training, and the equipment they need to do their job safely and effectively. To mark World Patient Safety Day next week, we're focusing on health worker safety as a prerequisite for patient safety. WHO will launch a charter for health worker safety, urging member states and all partners and stakeholders to commit to health worker safety as a priority for patient safety. We will also be issuing a range of advocacy, policy, and technical products for countries and 5 patient safety goals to promote safety measures in health facilities. I'm pleased to see that the safety of health workers and patients is included in the ministerial declaration you will adopt shortly. And thank you so much, and congratulations to you and also my sister Poonam. Excellencies, dear colleagues and friends, thank you once again for your commitment to saving lives. The ministerial declaration is a strong statement of regional solidarity. I will leave you with 4 essential priorities that we believe countries must focus on to control COVID-19 so they can reopen their societies, economies, and borders in the coming weeks and months. First, events through a risk-based local approach. In some places, this might mean suspending mass gatherings. In others, it might mean limiting them or finding creative ways to hold them safely. Second, reduce deaths by protecting essential workers and the most vulnerable groups, including older people and those with underlying conditions. Third, empower and educate individuals and communities to protect themselves and others by using physical distancing, hand hygiene, respiratory etiquette, and masks, not in isolation but together. And fourth, focus on the public health basics, find, isolate, test, and care for cases, and trace and quarantine their contacts. Above all, we must continue to work together in a spirit of solidarity. In the coming months, we hope to have good news about a vaccine. But we must ensure that once we have an effective vaccine, we use it effectively. As the representative of Myanmar said earlier, our priority must be to ensure that some people are vaccinated in all countries, not all people in some. The COVAX facility is the agreed international mechanism for ensuring equitable access to vaccines. I thank those countries that have expressed interest in joining COVAX, and I urge those of you that have not yet joined to do so by the 18th of September. COVAX is solidarity in action. This virus thrives on division, but together we will defeat it. I thank you. Namaste, Punam.
Many thanks, DG, for joining us today. I know it's very early for you. And right now, I would like to then hand over the floor to the chair, Vice Chair, His Excellency Mr. Banu Bhakta Dakal, Minister of Health and Population of Nepal. Over to you, sir.
Thank you, Dr. Roderico, for efficiently moderating the session. I would like to thank Excellencies, the Honorable Health Ministers, and the Head of Delegation for their very insightful, productive, and strategic intervention. Your contributions today show how proactively you have all been engaged in this epoch defining issue and how much each of our country has done to protect and save life through efficient, rational, and innovative utilization of available resources. We have learned much from each other today, and we surely care the best practice in terms of the multi-sectoral efforts and innovations tried in our respective countries back to our own settings. Excellencies, I would also like to thank you for your manageful engagement and constructive and timely inputs, which have enabled us to finalize the ministerial declaration for adoption today. I have been informed that the ministerial declaration has been prepared by the member states through an extensive consultative process. So let me hand over the floor to Dr. Hiroj, the advisor of Global Health, Ministry of Public Health, Royal Thai Government to provide more details of the declaration. Dr. Hiroj, you have the floor.
Thank you, Vice Chair, Madam Adi. The declaration has been prepared by all member states in our region with support from the Virtual Secretariat. The contribution by all member states are appreciated, and the pre-agreed final text has been circulated through email, and it is available with you. In the text, we have 7 key operative paragraphs. First, to improve USC and primary health care as a safety net for people in access to high-quality health services. Second, to ensure equitable access by all people to all essential health services without financial hardship. Third, to allocate adequate health budget to sustain uninterrupted health services during and after the pandemic. Fourth, to ensure occupational health, safety, and well-being of health professionals and strengthening safety of the patient. Fifth, to mobilize surge capacity in the society to mitigate the negative consequences of the pandemic. 6. To strengthen core capacity as required by the IHR 2005, including capacity for preparedness, surveillance, and rapid response, field epidemiological training, supply chain management, and stockpiling. And finally, to fully engage in global discussion on equitable allocation of vaccine, medicine, and diagnostic. These are the 7 key operative paragraphs in the declaration. And the declaration called the Individual Southeast Asia Region Member State Declaration. Over to you, Mr. Chair. Thank you.
Thank you, Dr. Biroj. Excellencies and distinguished delegates, I believe that every member state is in agreement with the draft declaration. I see no objection and hereby declare that the Southeast Asia Regional Member States Declaration on Collective Response to COVID-19 in Southeast Asia region is adopted. Now I request the Secretariat to display the adopted declaration. I would like to thank Honorable Minister for their active participation in the very interactive and informative roundtable discussion. Your presence has helped to make this event a great success. I would like to thank Dr. Offrin, who moderated the roundtable nicely. He was able to bring out the key intervention and strategies in all our member states. Would like to thank Dr. Poonam Chhatrapal Singh for her insight as well as her leadership in the region on this agenda. We look forward to implementing the WHO Southeast Asia Region Member States Declaration on Collective Response to COVID-19 together in coming years. Our commitment made here today will drive our action, and our actions will produce result. So let's disseminate the commitment widely and move forward together. Thank you all for your participation. Now I declare the ministerial roundtable closed. Excellencies, distinguished delegates, we will now move on to the side events. I would like to hand over the floor to the WHO Secretariat.
Events planned back to back. The first one is to acknowledge the public health achievements in Southeast Asia region, which will be followed by the video launch of WHO publications. I kindly ask the chair to now hand over to Dr. Aditama for moderating the side events.
Excellencies, honorable delegates, ladies and gentlemen. Dr. Poonam Katrapal Singh, during her tenure as a regional director of WHO's Southeast Asia region, prioritized the public health areas in which to focus technical support and resources to make tangible inroad into some of the many complex health issues of the region. Today's session, although brief, is the culmination of years of intense effort in improving public health by member states. We celebrate today the significant public health successes in the region on rubella elimination in 2 countries and on trachoma elimination and EMTCT in 1 country each. These achievements are clear markers of strong health system and demonstrate the capacity of countries of the Southeast Asia region to protect their population from communicable diseases. We will start with achievement on rubella elimination. The Regional Verification Commission for Measles and Rubella that comprises of independent experts from across the globe, after a careful review of evidence produced by countries, on 8 July 2020, verified that Maldives and Sri Lanka have achieved rubella elimination, making them the first 2 countries to have achieved this feat. Maldives reported its last endemic case of rubella in October 2015. Maldives was verified to have eliminated endemic measles in 2017. With this achievement, Maldives became one of the first 2 countries in the region to achieve the regional goal of measles and rubella elimination 3 years ahead of its scheduled timeline of 2023. This commendable achievement has been possible by the strong leadership and commitment of the government of the Republic of Maldives, sustained collaboration with WHO and partners, and active support of healthcare workers and communities at all levels of health services. I would like now to request the Regional Director to kindly deliver the citation for Maldives on the achievement of rubella elimination, and request Ms. Aisa Samia, Permanent Secretary, Ministry of Health, Republic of Maldives, to kindly receive the citation. Thank you, Permanent Secretary, and thank you, RD. Excellencies, honorable delegates, Sri Lanka reported its last endemic case of rubella in March 2017. Sri Lanka was also verified to have eliminated endemic measles from the country in 2019. With this achievement, Sri Lanka also becomes one of the first 2 countries in the region to achieve the regional target of measles and rubella elimination 3 years ahead of its scheduled timeline of 2023. Strong leadership and commitment of the government of the Democratic Socialist Republic of Sri Lanka, support from WHO and partners, and the dedication and commitment of healthcare workers and communities in the country have contributed to the success in Sri Lanka. I would like now to request Madam RD to kindly deliver the citation for Sri Lanka on the achievement of rubella elimination, and would like to request Her Excellency Ms. Pavitra Wani Arachi, Minister of Health, Government of the Democratic Socialist Republic of Sri Lanka, to kindly receive the citation. Thank you, Excellency, and thank you, RD. Now we are coming to trachoma elimination. Trachoma is the world's major infectious cause of blindness. In Myanmar, this disease was endemic in 11 districts of the dry zone, which has a population of around 6.2 million people. In 1964, the Ministry of Health and Sport initiated a trachoma control project with the support of WHO and UNICEF. Surveys between 2010 and 2015 demonstrated the program's steady success. Pre-validation surveys confirm it is no longer a public health problem in Myanmar. This creditable accomplishment was possible due to the sturdy government leadership with the continual partnership of all stakeholders. I would like now to request the Regional Director to kindly deliver the citation for Myanmar on the achievement of trachoma elimination and request His Excellency Dr. Min Wei, Union Minister of Health and Sport, Government of the Republic of the Union of Myanmar, to kindly receive the citation. Thank you, Excellency, and thank you, RD. Now we come to EMTCT, elimination of mother and child transmission of HIV and syphilis. Sri Lanka has become the third country in the Southeast Asia region and 14th globally to have eliminated mother-to-child transmission of HIV and or syphilis. The finding of the national, regional, and global validation teams confirm that Sri Lanka has met all impact and process indicator to validate Sri Lanka for the elimination of mother-to-child transmission of HIV and syphilis. This has been possible due to a strong leadership and commitment of the government of the Democratic Socialist Republic of Sri Lanka, strong focus on public health, and an integrated approach between HIV STI program and the MCH services. I would like to request the Regional Director to kindly deliver the citation for Sri Lanka on the achievement of eliminated mother-to-child transmission of HIV and syphilis, and request Her Excellency Ms. Pavita Wani Arachi, Minister of Health, Government of the Democratic Socialist Republic of Sri Lanka, to kindly receive the citation. Thank you, Excellency, and thank you, RD. Excellencies, distinguished delegates, ladies and gentlemen, the region continues to make unprecedented progress on priority health issues. We look forward to celebrating together many such achievements on the sidelines of the subsequent regional committee session. Thank you. Now we are coming to the second side event, that is launching of the publication. Excellencies, distinguished delegates, ladies and gentlemen, the virtual regional committee this year has witnessed new horizons, and to continue with this new tradition, we shall be launching publication virtually this time. There are 15 publications that are being launched during RC73 today, along with set of brochure of an annual update on progress toward the WHO Southeast Asia region's 8th flagship priority program, and also Southeast Asia Journal of Public Health September 2020 edition with the main topic of COVID-19. We will now see a video outlining brief information on the content of each of these 15 publications. The links to electronic version of all of these publications and contact details for publication copy requests are available on the RC mobile app. The video, please.
Every year, the WHO Southeast Asia region launches a series of publications during the regional committee session. This year, the following publications are being launched in the virtual session. Progress towards malaria-free. WHO Southeast Asia describes the progress in the region towards malaria elimination since 2010 and the different milestones, goals, and challenges that exist in each member country. This publication captures Myanmar's efforts for elimination of trachoma, a disease that can lead to blindness if not treated at an early stage, and which was endemic among 6.2 million people in Myanmar. A first-of-its-kind publication in the region, this covers the pictorial identification of 76 species of vectors transmitting diseases in WHO's Southeast Asia region. This is a user-friendly guide for public health workers, school teachers, students, researchers, and other interested groups. The Leprosy e-learning package is a set of web-based self-learning modules targeted for healthcare workers, doctors, physiotherapists, and others. The topics include diagnosis and treatment of leprosy, counseling of patients, managing reactions to treatment, and management of disabilities. Celebrate Life is a tribute to health workers delivering immunization and other essential health services during the ongoing COVID-19 pandemic. Those profiled in this publication represent the unwavering commitment of health workers across WHO's Southeast Asia region. Analysis of 3 rounds of tripartite EMR country self-assessment surveys in the region from 2016 to 2019 is in line with the World Health Assembly resolution for strengthening monitoring for antimicrobial resistance. We are the only WHO region with 100% participation in this survey for 4 consecutive years. This evaluation documents the progress at the regional and country level in each of the 8 flagships, including achievements and success stories, best practices, and key challenges encountered between 2014 to 2018. The regional strategic framework is focused on achieving 4 outcomes: delivery of high-impact interventions in prioritized areas, health system interventions, community mobilization for improved sexual and reproductive health rights, and fostering collaboration between member states for accelerating progress through learning from best practices and innovations. The report highlights the progress made in the region towards universal health coverage and health-related SDG targets. This year's report also includes a summary of the progress using country-comparable estimates. This midterm review assesses the health workforce situation and the progress made so far by member countries at the halfway mark of the decade. It assesses progress on health workforce governance, transformative education, rural retention, data, health workforce, and COVID-19, and progress made in the year of the nurse and the midwife. This publication analyzes the progress made on improving rural retention of health workers in the region and identifies some good practices from Bhutan, Indonesia, Myanmar, Sri Lanka, Thailand, and India. The report explains how coordinated efforts have led to the implementation of evidence-based policies by countries, thus improving the availability and distribution of health workers in rural areas. With non-communicable diseases posing a serious threat in the region and accounting for nearly 2/3 of all deaths, this report summarizes prevention and control measures for NCDs. The report highlights achievements as well as gaps that need to be addressed to prevent and control non-communicable diseases. This publication draws focus on a coordinated and multi-sectoral approach at all levels of health system to reduce the incidence of diabetes and the onset of diabetic retinopathy. Diabetic retinopathy is preventable. Periodic eye examinations by ophthalmologists accompanied by standard treatment of diabetic retinopathy can postpone serious loss of vision. The first edition of the Tobacco Atlas, Perspectives from the Southeast Asia region, attempts to project the present burden of tobacco use, progress made in the implementation of policies, and the laws for prevention and control of tobacco. It also identifies challenges and suggests the way forward. This document chronicles the change brought about by COVID-19, from epidemiology and laboratory surveillance to clinical management and risk communication, from partnership to logistics. This book identifies the shifts that have occurred and why. This publication is also a tribute to the strength and resilience of frontline workers and people of the region.
So thank you. This is the end of the side effect. I hand over back to the chair. Mr. Chair, please.
Excellencies, distinguished representative, welcome back. I thank all of you for your active participation in the side events and congratulate all member states for their achievement in the respective area. I also take this opportunity to congratulate the WHO Regional Director, Dr. Poonam Chhatrapal Singh, for proactive guiding the health agenda in the region. Let's now take up Agenda 10, Governing Body Matters. This agenda item, 2 sub-items. The first sub-agenda item 10.1 is review of the draft provisional agenda of the 148th session of the WHO Executive Board, which is part of the adopted written silence procedure. Kindly be reminded that the deadline for submission of the proposal for inclusion of an item on the agenda of the 148th sessions of the WHO Executive Board is tomorrow, 11 September 2020. Member states may consider submitting their proposal for inclusion in the agenda of any item along with an explanatory memorandum to WHO within the given deadline. The second sub-agenda item is Agenda 10.2, elective posts for governing body meetings. Excellencies, the WHO Secretariat has requested that we consider and take a decision on elective post of office bearer for the 74th World Health Assembly and the 149th sessions of the WHO Executive Board and the membership of the WHO Executive Boards and Program, Budget and Administration Committee from our region. According to the established practice, the proposed selections of elective posts of WHA, EB and PBAC members from the region has been suggested and it will now be presented to facilitate decision by the regional committee. I request the Secretariat to make the presentation.
Thank you, Your Excellency. It's my pleasure to briefly present the proposals to fill up these positions in the WHO governing body. So we have 3 governing bodies, which is the World Health Assembly, the Executive 149th Executive Board, and then the 34th Program, Budget and Administration Committee. On the 74th World Health Assembly, May 2021, we are required to nominate candidates for the President of the Assembly, Vice Chairperson of Committee B, Member of General Committee, and Member on the Committee on Credentials. For the 149th session of the Executive Board in May 2021, we are required to nominate one EB member to replace Indonesia, whose term expires, and also rapporteur. For the 34th meeting of the Program Budget and Administration Committee, we are required to nominate one to replace Bangladesh, whose term expires. As is always done, in the interest of transparency and consensus in the region, such proposals are always done on rotation basis and is discussed at the high-level preparatory meeting, and the proposal is as follows. For the World Health Assembly, the 74th World Health Assembly, the proposal is for the post of President, Bhutan is proposed. For the Vice President Committee, for the Vice Chairperson for the Committee B, Bangladesh is proposed. For the member in the General Committee, Sri Lanka is proposed. For the member in the Committee on Credentials, Thailand is proposed. And for the 149th session of the Executive Board, the proposed member is Timor-Leste, who will replace the current member Indonesia, whose term expires in May 2021. And it is also proposed that Bangladesh be the rapporteur. And finally, on the PBAC membership from the region, it is proposed that Timor-Leste replace Bangladesh, whose term expires in May 2021. Thank you.
Thank you. Are there any comments or observation from the floor on the proposal for elective post and executive board as well as on PBSA membership? In the absence of any observation, we approve the proposal as presented by WHO Secretariat. The regional director may inform WHO headquarters accordingly. Excellencies, distinguished representative, before we move to adoption of resolution and decisions, let us take up agenda item 12.2, UNDP, UNFPA, UNICEF, WHO, World Bank special programs of research, development and research training in women reproduction, Policy and Coordination Committee reports on the attendance at PCC in 2020 and nomination of the member in place of Bhutan, whose term expired on 31 December 2020. The high-level preparatory meeting held virtually in July 2020 has discussed the agenda in detail and recommended the nominations of Bangladesh to serve on PCC for the 3 years terms starting 1st January 2021 in place of Bhutan. Excellencies, distinguished representatives, Are there any observation, please? As there are none, the regional committee decided to accept the nominations of Bangladesh to be a member of the PCC for 3 years, effective 1 January 2021. Let us congratulate Bangladesh on its nominations to PCC. The regional director may inform WHO headquarters accordingly. Excellencies, distinguished representatives, we have already agenda and adopted the decisions on special procedures to regulate the conduct of the 73rd sessions of the RC. In addition, we have the following resolution and decision which are also agreed in advance by the member states. 1. Resolution to endorse the already adopted Southeast Asia Regional Member States Declaration on collective response to COVID-19 in the Southeast Asia region. 2. Decision on the draft Global Action Plan on patent safety. 3rd, decision on time and place of future session of the regional committee. And 4th, resolution of thanks. Since the member states have converted their agreement on the just maintained resolution and decision in advance of the sessions, I hereby take pleasure in declaring this resolution and decision adopted by the regional committee. Excellencies, distinguished representatives, you may agree with me that in view of the virtual format of the meeting, reduced duration and the fact that most of the agenda items are covered under written silence procedure, drafting live reports of the session may not be possible. Accordingly, I thank the member state for their understanding and kind agreements under the special procedures that the Secretariat will prepare of draft summary reports of the session following the closures of the sessions. I believe that Secretariat has taken note of the written inputs posted by the member state and the statement submitted by the non-state actors, intergovernmental organizations, and United Nations specialized agency, and will by incorporate them in the report of the sessions. The draft summary report will be sent electronically to all members of the region for their review and comments to be shared within 15 days of circulations of the draft report. The Secretariat, in consultation with the chairperson of the regional committee, will finalize the report, which will be considered to have been valid, adopted by the regional committee. Excellencies, distinguished representatives, thank you very much for all the cooperation and understanding. Let us now process of the final agenda item, closing of the session. And I would like to hand over session back to Honorable Chair. Thank you.
I have to say, and now the end is near, and so we are facing the final curtain. We shall now take up the last item of this virtual 73rd session of the Regional Committee, closing the session. May I now request the Regional Director, Dr. Poonam Singh, to deliver her closing remarks.
Thank you, Chair. Thank you, Chair. Honorable Chair, Vice Chair, Excellencies, Director General, distinguished delegates, ladies and gentlemen. As the Chair just said, we have come to the close of a successful regional committee. I thank our hosts, Thailand, for their commitment and their efforts to make this meeting a success. I thank your Excellencies for your keen engagement and your participation. I take this opportunity to also thank your Excellencies for this very useful comments and the suggestions that you made on my presentation of the 2019 annual report, which captures the progress we made over the year. At the same time, it reflects on the unprecedented challenges that COVID-19 has placed on every country. We must continue to vigorously implement the region's sustain, accelerate, innovate vision, as together we strive to protect and defend the many gains we have made across all areas of health. I thank the chair of RC73, His Excellency Anutin Charan Virakul, for reinforcing our message and commitment to sustain emergency response and preparedness and accelerate progress towards universal health coverage, with his comments on the need to focus on building stronger and more resilient health systems and to be better prepared for the pandemic for our people and for future generations. I thank the Director General for his participation in the MRT, notwithstanding his personal inconvenience. He has demonstrated his commitment to the region and to the subject matter of discussion, that is the continuation of essential services during a pandemic as grave as COVID-19. I'm happy that His Excellency Dr. Mintwe, Minister of Health and Sports, Myanmar, appreciated the support provided by WHO, and in responding to his comments on focused support to countries, let me state that the Southeast Asia region has always focused in our daily work on prioritizing member states' concerns as flagships, or perhaps being the only region that provides the maximum resources at the country level towards these various programmatic areas. In the last biennium, we had distributed 86% of our total resources to the countries. In addition, what was implemented by the regional office was also very largely at country level. Further, 93% of the funds that we have received for COVID-19 have again been distributed to the countries. I would also like to touch upon the suggestion of Her Excellency, Mrs. Pavitra Varai Chehel, on strengthening safety of international travel and inform the honorable ministers that WHO has recently released the guidelines on public health considerations while resuming international travel, which would be useful to countries in resuming safe travel as their economies open up. Excellencies, the Ministerial Roundtable was an immense success and will strengthen the region's collective response to COVID-19. Solidarity and cooperation have been central to the region's ethos for many years now, and a feature of our pandemic response as well. The Member States' declaration affirms the region's resolve to strengthen the response and to build a healthier, more health secure region and as we move into recovery and beyond. By pursuing universal health coverage with a focus on primary care services, by scaling up emergency risk management to achieve full IHR compliance, and by strengthening investments in health in the weeks, months, and years to come, together we can achieve our many objectives and continue the region's winning trajectory. I thank all of you for the very appreciative comments made about our work together in both yesterday and today's sessions. The very useful and constructive comments will be appropriately reflected in our RC report. In recognizing the successful deliberations of the Regional Committee, I express my sincere gratitude to His Excellency Anatun Chandravirakul, Deputy Prime Minister and Minister of Health of the Royal Thai Government, for the effort he and his team has put into hosting this. I thank the Vice Chair, His Excellency Mr. Bhanu Bhakt Dhakal, Honorable Minister of Health and Population, Government of the Federal Democratic Republic of Nepal, for his continued support and for very effectively chairing some of the parts of the RC. I thank the DG, WHO, and the headquarter team for the energy and insight they brought to the committee and for their ongoing support, not only to the region's response, but also across all programmatic areas. I thank the many non-government and intergovernment organizations that participated and who continue to partner us. The challenges we face cannot be solved by just member states and WHO alone, but do require the whole of society buy-in, as was emphasized by our distinguished representative from Maldives. Finally, I give my sincere thanks to the CRO Secretariat, especially the ICT team, for the hard work they put in to ensure this first ever virtual RC was seamless. Our work to advance regional and global health continues, as it must, for the health, well-being, and sustainable development not only of all people in this region, but also across the world. Thank you. The Nepal Health Minister to kindly say a few words.
Excellencies, distinguished delegates and representatives, I am optimistic that all our hard work and solidarity will produce good result to bring this pandemic under control. Let us join hands together to bring it under control as early as possible. Your Excellencies, we have already initiated the preparation of 74th Regional Committee meeting to be organized in September 2021 in Nepal. We wish the pandemic of COVID-19 will be over very soon, and we will meet on next September in Nepal. I would like to inform that Nepal is the home of many old heritage sites, the birthplace of Lord Buddha, and stewards in the Himalayan region, peaks in the world, including Mountain Everest. We look forward to welcoming you all in Nepal. Thank you so much. Namaskar.
Thank you very much. We have now come to the end of the virtually held RC73. I am sure all of you will agree with me that despite of limited time available, this virtual RC73 has certainly been very productive. The decisions and recommendations are adopted in an atmosphere of cordiality and cooperation, especially the WHO Southeast Asia region member states declaration on COVID-19. These will go a long way in further protecting and improving the health of our people. Once again, I would like to thank all distinguished representatives for their active participation and constant support in the discharge of my functions. I would like to thank His Excellency Mr. Manu Bakhtar Dakal, Honorable Minister of Health and Population, Government of Federal Democratic Republic of Nepal, Vice Chairperson of this meeting, for his full cooperation and support. I wish to place on record our appreciation to Dr. Ted Ross, the Director General of WHO, for his vision and guidance. I also take this opportunity to thank WHO senior management from headquarters and regional office for their valuable contributions to this meeting. The representatives of UN agencies, non-state actors, and development partners also deserve our appreciation, and I thank them for their contribution to the work of this committee. Distinguished colleagues, let me also acknowledge the Ministry of Public Health, the Royal Thai Government, and WHO Secretariat for their hard work and dedication to make this virtual regional committee session successful. Before concluding, I would like to place on record our collective appreciation and grateful thanks to our dear Regional Director of WHO Southeast Asia, Dr. Poonam Singh, for effectively guiding the work of the region and paving the way forward through her flagship priorities. I hope I could get to see you soon. We would like to offer our full support and commitment to the Regional Director personally, as well as to the regional office and country offices in discharging their role in conformity with the Constitution and principles of WHO. The COVID-19 pandemic has reinforced the importance of the WHO transformation agenda and its overall goal of ensuring that WHO is fit for purpose to effectively respond to the needs of the member states in a rapidly changing global health environment. The strong relationship and commitment of the Regional Director for Southeast Asia, particularly expressed through the clear directives of the 8 regional flagship priority programs, has allowed the region to enhance its policies and technical support to member states and strengthen focus on financing and staffing needs in line with existing priorities. We hope that the WHO transformation agenda will result in further strengthening of the regional office and mechanisms to offer needed support to member states in keeping with country-determined priorities and results towards the achievement of the regional flagship priorities in alignment with the 13th General Program of Work. We are sure that you would utilize the opportunities offered to further the objectives of regional solidarity, collaboration, and voice. I am confident that all of us are fully determined to improve the health of our people. With that, I declare the 73rd session of the WHO Regional Committee for Southeast Asia closed. May I wish you best of luck.
in the region to provide impetus on the implementation of RCEP.
Member States, good morning.
To Your Excellencies, Director. Initiatives
in a very
initiatives. Sustainable
in the
कंगना रनावत अपने घर में मौजूद नहीं थी, जब वो शहर में मौजूद नहीं थी, तो फिर उनके एब्सेंस में आपने ऐसी कार्रवाई करके आखिर क्या हासिल कर लिया? क्या पॉलिटिकल प्रेशर इतना ज्यादा था कि आप मजबूर हो गए ऐसी हरकत करने के लिए? थोड़ा सा अगर आगे मैं और जाता हूं तो एक यहाँ पर और मुझे मुंबई पुलिस की यहाँ पर वैन जिप्सी नजर आ रही है, तो कुल मिलाकर एक एस्कॉर्ट व्हीकल, 2 मुंबई पुलिस की, 1 2 3 4 5 यानी 5 मुंबई पुलिस की गाड़ियां हैं, एक एस्कॉर्ट व्हीकल है। 35 से 40 तो मुंबई पुलिस के कर्मी हमने आपको दिखा दिए वहां पर हैं, करीब 10 से 15 अंतर है, तो आप अंदाजा लगा सकते हैं। अनप्रेसिडेंटेड सिक्योरिटी जो है वो ग्राउंड जीरो पर इस वक्त नजर आ रही है, सिर्फ कंगना रनावत के लिए, यानी जब वो यहां से अपने बंगले से बाहर निकले और पाली हिल बांद्रा का इलाके में जाए, यानी खार इलाके से बांद्रा जहां पर उनका बंगला है जो अब तोड़ दिया गया है, वहां तक पहुंचने का रास्ता आप समझ लीजिए 20 से 25 मिनट का है। बहुत से बहुत ज्यादा अगर ट्रैफिक लग जाते तो आधे घंटे का समय लगेगा। तो इस आधे घंटे के रास्ते को मैं दूसरे बैक गेट पे भी जाने की कोशिश करता हूं। कुछ एक गाड़ी का मूवमेंट मुझे यहाँ पर नजर आ रहा है। मेरे कैमरा पर्सन राजीव नामदार मेरे साथ हैं। गाड़ी तो निकल रही है यहाँ से। क्या इस गाड़ी में कंगना रनावत जाएंगी ये कहना थोड़ा मुश्किल है, लेकिन हर पल जो भी डेवलपमेंट हो रहा है इस बिल्डिंग में उसकी पल पल की जानकारी हम यहाँ पर दर्शकों को दे रहे हैं। और अब पूरे ऐसे कयास लगाए जा रहे हैं कि कंगना रनावत यहाँ से निकल सकती हैं। निकल के वो आखिर कहाँ जाने वाली हैं? इन ऑल लाइक्लीहुड शायद अपना जो उनका पाली हिल में उनका जो ऑफिस है वहां पर जाएंगी और असेसमेंट करेंगी आखिर क्या हुआ है, क्योंकि उनके लॉयर जो रिजवान सिद्दीकी हैं उन्होंने तो कल ही कह दिया था कि वहां पर जो उनका पर्सनल जो सामान था, उन्होंने जो संजो कर जो सारे सामान रखे थे, इतने सालों से उन्होंने जो संजो का सामान रखा था, उनका जो डैमेज कर दिया है, दे विल सीक द डैमेजेस एज वेल। और सुबह ही वो बता रहे थे करीब 2 करोड़ के आसपास उन्होंने डैमेजेस का असेसमेंट किया है और वो कहेंगे कोर्ट के सामने जाकर। देखिए, बीएमसी ने डिमोलिशन के नाम पर, स्ट्रक्चर्स को गिराने के नाम पर आखिर क्या किया है? आर्टिफैक्ट्स तोड़ दिए हैं, पर्सनल जो फर्नीचर था उसको तोड़ दिया है, ड्रिलिंग मशीन जो है दीवारों के अंदर घुसा दी और फिर उसको निकाल दिया गया है, जितने पंखे थे उनको उखाड़ फेंका है। देखिए, कोर्ट के सामने कहा जाएगा क्या ये तरीका था स्ट्रक्चरल चेंजेस को ध्वस्त करने का, तो सवाल बहुत बहुत ज्यादा होंगे तीखे। अब कोर्ट फैसला करेगी बीएमसी ने जो किया क्या वो ठीक किया या इसमें द्वेष की भावना थी, पॉलिटिकल प्रेशर था, क्योंकि अब तो मामला इतना ज्यादा बढ़ गया है।
सॉरी, फिर से स्टार्ट करता हूं।
चलेंगे।
तो इस वक्त की बड़ी खबर, कंगना रनावत की याचिका पर बॉम्बे हाईकोर्ट में सुनवाई टल गई है। 22 सितंबर को इस मामले में अगली सुनवाई होगी और इस बीच एक्शन इस वक्त कंगना रनावत के घर पर होने वाला है, क्योंकि जानकारी मिल रही है कुछ ही पल में अपने खार वाले घर से निकलेंगी कंगना रनावत, सीधे पहुंचेंगी मणिकर्णिका फिल्म्स, अपने उस दफ्तर में जहां कल बीएमसी ने जाकर हथौड़ा चलाया था। सीधे आपको लेकर चलते हैं। अभिषेक रावत हमारे साथ लगातार बने हुए हैं। अभिषेक, अपडेट।
जी रोमाना, अभी अपडेट यही है कि पुलिस की गतिविधियां थोड़ी बड़ी हैं, लेकिन अभी फिलहाल कंगना अपने घर से बाहर नहीं आई हैं। हाँ, हलचल जरूर तेज है, अंदर भी कुछ गाड़ियां अभी गई हैं, तो बहुत संभव है कि अब से कुछ ही पलों बाद कंगना बाहर निकलेंगी और फिर अपने ऑफिस की तरफ आगे बढ़ेंगी। फिलहाल जो है पुलिस
गाड़ियां अंदर गई हैं, कुछ गाड़ियां अंदर गई हैं, जो अभी आपने कहा, कौन सी गाड़ियां हैं जो अंदर गई हैं?
जी, असल में जो गाड़ियां हैं वो प्राइवेट गाड़ियां थी, लेकिन अभी वो भी स्पष्ट
देखी है यूपी के फिरोजाबाद में, जिस शख्स को पीटा जा रहा है उस पर फोन
to offer my deepest condolences at the loss
आशियाने को निहारने के बाद कंगना बाहर निकल आई।
कंगना रनावत लगभग 10 मिनट तक अपने दफ्तर पर रुकी और यहां से जाती हुई हाथ उन्होंने बांधे हुए हैं और चेहरा नीचे है। कुछ वो चली गई हैं अपनी बहन के साथ। ये वो वक्त है जब कंगना को लग रहा होगा कि आज वो उसी चौखट पे आके खड़ी है जहां से उन्होंने अपना सफर शुरू किया था, क्योंकि बेहद आहत और निराश नजर आ रही हैं। अब देखना होगा कि जो भी जायजा उन्होंने यहाँ से लिया है पूरा यहाँ इलाके में
ये कंगना और सच की जीत है। इरादों का पता इसी बात से चल जाता है कि कंगना रनौत 9 सितंबर को ही मनाली से मुंबई पहुंची, लेकिन उससे पहले ही बीएमसी तोड़फोड़ शुरू कर चुकी थी।
ये वही बीएमसी है जिसका बजट कई राज्यों से ज्यादा है, फिर भी मुंबई के हजारों गड्ढे आज भी जस के तस हैं। जैसे ही आला कमान का ऑर्डर मिला, पहुंच गए कंगना के ऑफिस में तोड़फोड़ करने।
कोर्ट में बीएमसी और कंगना की ओर से अपने पक्ष रखे गए। किसका पक्ष ज्यादा मजबूत और सच्चा था, ये आप इस बात से समझ जाइए कि कोर्ट ने बीएमसी को आदेश दे दिया है कि फौरन कार्रवाई को रोका जाए। किसी तरह की तोड़फोड़ अब नहीं होगी जब तक कि कोर्ट कोई फैसला नहीं देता है। कंगना का साफ साफ कहना है कि बीएमसी का ये कदम गैर कानूनी है। किसी के कहने पर ऐसा कदम उठाया गया है। अब कोर्ट ने दोनों का पक्ष मांगा है।
कंगना के दफ्तर में तोड़फोड़ का मामला बॉम्बे हाई कोर्ट तक पहुंच गया है। इस मामले की अगली सुनवाई 22 सितंबर को होगी। कंगना अपने कागजातों को 14 सितंबर तक फाइल करेंगी, वहीं बीएमसी को अपना जवाब 18 सितंबर तक देना होगा।
कंगना की ओर से कहा गया है कि ऑफिस में जितना नुकसान हुआ है वो करीब 2 करोड़ रुपए का है। साजिश का दायरा कितना बड़ा है ये आप इस बात से समझिए कि बीएमसी की नजर कंगना के घर की ओर भी लगी है, ताकि मौका मिलते ही उसको भी नुकसान पहुंचाया जाए।
कि कंगना के घर के बाहर पुलिस की हलचल बढ़ गई है। क्या यहाँ भी एक्शन होने वाला है? क्या यहाँ भी बीएमसी तोड़फोड़ करने आने वाली है? अचानक ये पुलिस का मूवमेंट नहीं बढ़ा है, इसके पीछे क्या कुछ वजह है? तस्वीरें हम आपको दिखा रहे हैं, देखिए जरा। अचानक हलचल बढ़ गई है, पुलिसकर्मी मुंबई के एकदम से अचानक बढ़ गए।
सुशांत सिंह राजपूत की मौत के बाद से कंगना रनौत महाराष्ट्र सरकार और शिवसेना पर हमलावर है। इसी से बौखलाई उद्धव सरकार और उसके नेता कंगना के पीछे हाथ धोकर पड़ गए हैं। कंगना को भद्दी गालियां दी गई, उन्हें मुंबई न आने की धमकी दी गई। जब कंगना ने सीधे उद्धव ठाकरे को चैलेंज किया तो एक और साजिश सामने आ गई। मुंबई के विक्रोली थाने में कंगना रनौत के खिलाफ शिकायत दर्ज करवाई गई। इसमें कहा गया है कि कंगना ने महाराष्ट्र के सीएम के खिलाफ अभद्र भाषा का इस्तेमाल किया है। शायद ही पहले कभी देखा गया हो कि एक राज्य और सिविक एजेंसियां एक महिला के पीछे इस तरह पड़ गई हो। लेकिन सवाल ये कि आखिर कंगना के सुशांत की मौत पर सवाल उठाने से इतना हड़कंप क्यों मचा हुआ है? इसे बचाने के लिए कंगना की आवाज दबाने की कोशिश की जा रही है। ब्यूरो रिपोर्ट, रिपब्लिक भारत।
कंगना को चुनौती देने वाली उद्धव सरकार के सारे पैंतरे धरे के धरे रह गए और उद्धव सरकार का, महाराष्ट्र की सरकार का, शिवसेना का सारा दाव उल्टा पड़ गया। अब यही उद्धव सरकार बुरी तरह फंसती नजर आ रही है।
कंगना की ललकार सुन लो उद्धव सरकार। पहले से ही ताल ठोक रही कंगना ने मुंबई पहुंचते ही उद्धव ठाकरे को ललकारा।
उद्धव ठाकरे, तुझे क्या लगता है कि तूने फिल्म माफिया के साथ मिलके मेरा घर तोड़ के मुझसे बहुत बड़ा बदला लिया है? आज मेरा घर टूटा है, कल तेरा घमंड टूटेगा।
सत्ता के घमंड में चूर उद्धव सरकार ने बीएमसी के कंधे पर रखकर कंगना के दफ्तर पर बुलडोजर तो चला दिया, लेकिन इससे कंगना के हौसले हिले नहीं, बल्कि कंगना के तेवर और तीखे हुए हैं।
कंगना के पीछे हाथ धोकर पड़ी उद्धव सरकार को शायद लगा था कि ऑफिस पर बुलडोजर चलवाने से कंगना घुटनों के बल आ जाएगी, लेकिन उसके बाद तो कंगना उद्धव सरकार पर और हमलावर हो गई। ट्विटर पर कंगना ने जबरदस्त मोर्चा खोल दिया। कंगना ने इधर उधर की बातें नहीं की, बल्कि सीधे उद्धव पर हमला किया। कंगना के तेवर कितने तीखे थे, जरा इस ट्वीट में देखिए।
तुम्हारे पिताजी के अच्छे कर्म तुम्हें दौलत तो दे सकते हैं, लेकिन सम्मान तुम्हें खुद कमाना पड़ता है। मेरा मुंह बंद करोगे मगर मेरी आवाज मेरे बाद लाखों में गूंजेगी। कितने मुंह बंद करोगे, कितनी आवाजें दबाओगे, कब तक सच्चाई से भागोगे? तुम कुछ नहीं हो, सिर्फ वंशवाद का एक नमूना हो।
बीएमसी का एक्शन उद्धव सरकार के गले की फांस बनती जा रही है। एक तरफ जहां शरद पवार ने इस मामले से खुद को अलग कर लिया है, इसके बाद महाराष्ट्र की महाविकास आघाड़ी सरकार यानी कि उद्धव सरकार के ऊपर संकट के बादल मंडराने लग गए हैं।
कंगना के साथ पूरा भारत खड़ा दिख रहा है, तो वहीं मराठा गौरव की बात करने वाली शिवसेना इस मसले पर पूरी तरह से अलग थलग पड़ गई है। वैसे भी कंगना ने वक्त का हवाला देकर उद्धव सरकार को चेतावनी दी है।
ये वक्त का पहिया है, याद रखना, हमेशा एक जैसा नहीं रहता।
कंगना अपने उजड़े हुए दफ्तर को देखने गई, लेकिन अपनी जिद के साथ पहले से भी ज्यादा मजबूती के साथ खड़ी। पर्दे पर भूमिका निभा चुकी कंगना असल जिंदगी में भी रानी लक्ष्मीबाई की तरह लड़ रही है। बॉलीवुड गैंग के खिलाफ मोर्चा खोलने वाली कंगना अब सीधे उद्धव सरकार को चुनौती दे रही है। अब कंगना फ्रंट फुट पर है तो सरकार धीरे धीरे बैक फुट पर पहुंचती दिख रही है। ब्यूरो रिपोर्ट, रिपब्लिक भारत।
दोस्तों, नेशनल कमीशन ऑफ विमेन ने कहा है कि अगर कंगना रनावत के खिलाफ एक्शन है तो संजय राउत की अभद्र टिप्पणी के खिलाफ एक्शन क्यों नहीं है? शिखा, बहुत महत्वपूर्ण बात है कि ये हिपोक्रेसी क्यों? शिखा।
बिल्कुल प्रदीप, देखिए अब महिला आयोग भी इस मामले में सामने आ गया है, तो वही चीज जो बार बार सामने आ रही है कि ये जो लड़ाई है वो एक अलग लेवल तक चली गई है, क्योंकि जो लड़ाई संजय राउत ने शुरू की थी, लेकिन यहाँ पर कंगना रनावत जो है वो लगातार पलटवार कर रही है। संजय राउत का एक्शन था और ये कंगना का रिएक्शन है। अब महिला आयोग भी सामने आया है और कह रहा है कि कंगना रनावत के लिए मुंबई पुलिस यहाँ पर क्यों नहीं आई, संजय राउत के खिलाफ एफआईआर क्यों नहीं हुई, क्योंकि उन्होंने अमर्यादित भाषा का प्रयोग किया था संजय राउत ने, जिसके बाद कंगना रनावत जिन्होंने पलटवार किया है उसके बाद तो देखिए उनका ऑफिस भी तोड़ दिया गया। तो अब ये जो लड़ाई है वो एक अलग लेवल पर चली गई है प्रदीप, क्योंकि अब उस स्तर की नहीं रही है। अब ये 22 सितंबर की जो तारीख आएगी उस समय पता चलेगा कि क्या होगा। बीएमसी को उसका अगर ऐसा पाया जाता है कि बीएमसी ने अवैध तरीके से ये तोड़ा है तो उसको एक एक पाई चुकानी पड़ेगी। ज्योत्सना।
बिल्कुल शिखा, अब देखिए जिस तरह बीएमसी ने कंगना रनौत के दफ्तर को तोड़ा है, उसके बाद से देखिए बीएमसी का दोहरा चरित्र कैसे सामने आया, ये हम आपको बताते हैं। दरअसल एक ही दिन मनीष मल्होत्रा और कंगना रनौत को नोटिस भेजा गया था।
अपना छोटा सा आशियाना वहां पर मुंबई में जहां वो काम करती थी, उनका ऑफिस वो तोड़ दिया गया। लाखों की तादाद में गैर तरीके से वहां पर, गलत तरीके से वहां पर जो है कंस्ट्रक्शन हुई पड़ी है, लेकिन एक ही नाम के साथ जुड़ा हुआ वो विषय क्यों चुना गया?
ठाकुर साहब, हिमाचल में भी बहुत सारे ऐसे अवैध कंस्ट्रक्शंस होंगे जिन पे सरकार की नजर जाती होगी और सरकार के ऊपर दबाव रहता होगा कि इन पे कार्रवाई की जाए, और मौका आने पे सरकार जब तक करती भी होगी कार्रवाई फिर उगाते होंगे। लेकिन आप ऐसे कोई बड़े कद की वीवीआईपी किसी और राज्य की बेटी के आशियाने पर अपने यहां कार्रवाई कर देंगे कानून के तहत, तो आप भी तो जस्टिफिकेशन देंगे ना कि कानून ने कहा, नियम है, उसका उल्लंघन था इसलिए हम कार्रवाई कर रहे हैं। क्या आपको लगता है कि प्रेस कॉन्फ्रेंस करने के बजाय आप अगर वाकई हिमाचल की बेटी
India initiated public health measures to prevent and contain